Are the infections more than or equal to 8 episodes per year if the child is under 3 years, and more than or equal to 6 episodes per year if child is more than or equal to 3 years. So a child's health, their education, their growth and peace of every parent is affected due to this recurrent respiratory tract infections. So when these episodes become a pattern rather than an exception, so we need something that goes deeper than just symptomatic management. So something that strengthens the child's immunity. So here comes the role of tuberculinum. And this study presents, this study initiated to investigate the efficacy of tuberculinum in reducing episodes of recurrent respiratory tract infections in children. So the aim to study the efficacy of tuberculinum in reducing episodes of recurrent respiratory tract infections in children. Objectives were to assess the reduction in frequency, duration, and intensity of recurrent respiratory tract infections in children. To study the effect of treatment on clinical presentation of recurrent respiratory tract infections in children, and also to study the symptoms of tuberculinum. So before going in methods and results, I just want to tell you that why I chose tuberculinum. So this tuberculinum is more than just a remedy. It represents a deep-seated susceptibility. It is indicated for children who fall sick easily, recovers very slowly, and again fall sick from slightest change of weather. It addresses poor resistance, low immunity, recurring throat, nose, and ear complaints, and children who never truly completely recovered. So in short, this tuberculinum is a constitutional match for a child that trapped in a recurrent respiratory tract cycles. So our intention was not only to treat episodes, but to break this cycle completely. So our methodology is in that inclusion criteria. So we have included patients or children with recurrent respiratory tract infections, which satisfy our definition from our college OPD. All genders and all socioeconomic status were included. Age group 1 to 18 years. Exclusion criteria were lower respiratory tract infections were excluded. The patients with known case of history of tuberculosis, children with congenital anomaly affecting upper respiratory tract, children with immunocompromised diseases and other comorbidities. Then outcome assessment criteria, how I had assessed. So outcome assessment were based on reduction in number of episodes of respiratory tract infections. Because the definition itself says that if 6 or more episodes are there, we call it as a recurrent respiratory tract infection. So assessment is based on reduction in number of episodes. So this is chart how I have enrolled and how I have planned the study. So the initially 15 children were assessed for eligibility. Their consents are taken. Then 5 children are excluded because they are not meeting the inclusion criteria. So cases selected were 10 patients. They all are prescribed with tuberculinum 1M single dose. Post-treatment assessment was taken, monthly follow-up for 12 months, and assessment before and after the treatment. That is number of episodes before the treatment and after the treatment. Then these are the results. You can see in my 10 patients, the 6 patients were male, 4 patients were female. Age group includes 5 patients from 1 to 6 years, 3 patients from 7 to 12 years, 2 patients from 13 to 18 years. And we know that there are different presentations of recurrent respiratory tract infections, like common cold, sinusitis, tonsillitis, otitis media, then laryngitis. So in my case, there were 3 patients of recurrent common cold, 3 patients for sinusitis, 2 patients were of tonsillitis, and 2 patients of otitis media. So total 15 were screened, 10 enrolled, 10 cases were analyzed at the end. Paired t-test was applied at the end of study, which shows statistically significant reduction in the episode of recurrent respiratory tract infections. Here p-value is less than 0.05. So out of 10 patients, 8 patients showed marked improvement. But beyond these numbers, the changes reported by parents were more important. Like, my child is falling sick less often. He recovers faster now. No antibiotics given for a month. And she is attending school regularly. So this is exactly kind of transformation we need or we aim for. Okay? So here discussion. The outcome aligned with previous homeopathic clinical experiences where tuberculinum was shown to act on individuals with tubercular miasmatic background, particularly those exhibiting tendency towards frequent respiratory ailments, poor resistance, and slow recovery. The observed reduction in recurrence may be attributed to the improvement in immune response and correction of underlying susceptibility, which is consistent with holistic approach. So as this is a pilot study, there are some limitations. Like, the sample size was too small. This is single blind design, which may introduce observer bias. Also, the environmental factors, nutritional status, and previous treatments were not fully controlled. So nevertheless, this pilot study demonstrated feasibility and clinical benefits, suggesting that a larger randomized control trial could provide more robust evidence of tuberculinum's efficacy. Then conclusion, the pilot study aimed to evaluate the feasibility and acceptability of tuberculinum and the methods to inform the design of fully powered definitive clinical trial. So tuberculinum was prescribed on basis of recurrence and was thus helpful in reducing the intensity and recurrence of episodes of recurrent respiratory tract infections. This framework set out here for future effectiveness analysis appears sufficient where the homeopathic intervention demonstrate modest effectiveness. Then there are some implications like clinical implications. This tuberculinum may serve as a useful adjunct or preventive remedy for children suffering from RRI, particularly when recurrent infection persists despite of conventional management. Regular monitoring and individualized homeopathic prescribing may help to reduce antibiotic overuse and enhance children's overall immunity. Research implications. The pilot results justify conducting a larger, multi-centered, double-blind randomized control trial to validate these findings. And future research should include control groups, longer follow-up durations, and objective immune parameters like immunoglobulin levels, cytokinin markers. Then public health implications. If validated, tuberculinum could become a cost-effective preventive measure for recurrent infections in pediatric population, especially in low resource settings. Promoting such integrative approach may reduce healthcare cost and improve quality of life for affected children. So these are some references I had used. So before I close, I am very pleased to share an important update. Like, based on this positive outcome of this pilot study, I am now conducting a larger scale randomized control trial with 280 children. In that, group A is 140 children receiving tuberculinum and 140 children receiving individualized homeopathic medicines. So this is comparative study, and this study is ongoing now. So thank you.
Thank you, ma'am, for the deep, insightful session. Your contribution has truly strengthened today's deliberations. We shall now move on to our next speaker, Dr. Vibhavari Gupte.
Good morning, everyone. I am Dr. Vibhaviri Gupte, Assistant Professor in the Department of Forensic Medicine and Toxicology in Anantarao Kanse College, and I have been teaching there since 7 years. I am from Maharashtra, Pune. So today my title is Effectiveness of Individualized Homeopathic Medicines in Managing Pain Associated with Osteoarthritis of Knee. It was a non-randomized clinical trial. The focus of the study was only on pain of the osteoarthritis. Introduction. Osteoarthritis is the second most common rheumatological problem with prevalence of 22 to 39% in India. And this is the reason why I choose this topic, that it is covering a large population. Also known as degenerative joint disease of the knee, it is typically a result of wear and tear and the progressive loss of articular cartilage. In spite of that, conventional medical treatment of osteoarthritis successfully relieves pain only, alongside producing adverse gastrointestinal and cardiovascular effects, especially when they are used for a very long time. Hence, many patients use complementary medicines, and especially homeopathy is used because it is safe and it has very less side effects. Aim of my study was to study the effectiveness of individualized homeopathic medicines in managing pain of knee osteoarthritis. For this study, I have used KOOS scale, that is Knee Osteoarthritis Outcome Scale. So in this, there are 33 questions. It's just like a Likert scale. So what type of pain you are having, mild, moderate, severe, or extreme, or none. So the points are given 0, 1, 2, 3, 4. Like that, 33 questions are there. So while the patient was enrolled, first of all, KOS scale was given to them. And this was followed after every 3 months. Even though the follow-up was for 15 days, or as per the requirement of the case, but this KOS scale was taken at 3 months interval. So my objectives of the study was to evaluate the patient of knee osteoarthritis on knee osteoarthritis outcome scale in the pre-intervention, in post-intervention, and to assess the before and after effect using this KOS scale. So methodology, the study was conducted to assess the knee function and symptoms in the individuals. I'm again saying it was only symptomatic study which we have done. We have not gone in the structural changes. In individuals with knee osteoarthritis, using the knee injury and osteoarthritis outcome score, each participant completed this KOS questionnaire at every 3-month interval. Data was analyzed to determine the severity and the distribution of the symptoms and functional impairment across the study population. Descriptive statistic, ANOVA test, and correlation analysis were performed using appropriate statistical tests. Sample selection for this criteria was, we gave American College of Rheumatology criteria has given some symptoms to diagnose this osteoarthritis. So when you're having history and physical examination, so the compulsory symptom should be pain in the knee. And any of the 3 of the following, that is, the person should be over the age of 50 years, there should be morning stiffness, which should be less than 30 minutes, there should be crepitation on active motion, there should be bony tenderness or bony enlargement. So out of these 5 points, at least 3 points should be present to diagnose the person as ONE. Whereas, using history, physical examination, and radiological findings, the compulsory symptom is pain in the knee, followed by any one of the following. So if the patient is over 50 years and having a radiological evidence that he is having ONE or the changes in the X-ray, then we can consider this patient under our treatment. Other symptoms were less than 30 minutes of morning stiffness, crepitation on active motions, and osteophytes, no palpable warmth of symptoms, supported by radiological evidence. Inclusion of my study was all the patients above 18 years of age who are able to give consent, all genders and all socioeconomic status, clinically diagnosed knee osteoarthritis as per American College of Rheumatological criteria, but it should be supported by radiological evidence. So before entering the patient in the study, patient should have an X-ray which says that there are some changes. With or without involvement of any other joint, patient who is already undergoing regular oral or topical analgesics or NSAIDs therapy for acute painful episodes, provided that time the medication should be completely. Means the person is not supposed to take any medicines during the time the patient is under our treatment. Exclusion criteria: knee pain due to any other disorder than OA, like rheumatoid arthritis, SLE. Intra-articular injection, if the person has taken it within 2 weeks, the person will be excluded. Clinical evidence of psoriatic arthritis, how we are going to know that? By the history of psoriatic lesions. And pregnant and lactating females were excluded. Withdrawal criteria: patients who are not willing to continue, patients with irregular follow-ups, and if the patient starts another treatment during the study period were excluded again. So this study started in October 2022. First, we assessed for the pain in knee joint patients. Then assessed was 53, out of which 4 and 7 were excluded because 4 were not meeting the inclusion criteria and 7 declined to participate. So cases selected were 42. We had prescribed this 42 patients individualized homeopathic medicines, but there were 6 dropouts. So total study population was 36. Results: 36 participants completed the study, out of which 31 showed marked improvement. The cases underwent assessment using QoS at the baseline and at the interval of 3 months till the end of the treatment to evaluate changes in the pain, which was studied using repetitive ANOVA measure test. Out of 36, there were 21 females and 15 were male. So in this, we can understand the epidemiology that women are more prone to osteoarthritis. Why? Because because after the age of 40, there is calcium deficiencies and also some biomedical problems. Also, we can see the age group. So 35 to 54 and 55 to 74 were the highest number of patients, that is 15 and 14, whereas 18 to 34 is very less number, that is 4, and 75 plus were also very less because they had some other comorbidities along with them. Discussion. These findings are in accordance with the holistic principle of homeopathy, that we not only treat the symptom but the patient as a whole. Improvement in both pain and function, vitality and response to the stress, which are often impaired in chronic degenerative conditions like OA. Here, homeopathy is very helpful. Limitation of my study was, as it was a non-randomized study and it did not include a control group, which restricts the ability to draw definite cause-effect conclusions. So if we are not taking RCT, then I am not able to conclude what is the causation of this condition. The sample size, though it was adequate for the pilot study, but it should be expanded for the further studies. Conclusion: the study demonstrates the feasibility and effectiveness of individualized homeopathic medicines in patients with knee osteoarthritis as assessed using KOS scale. Out of 42 enrolled, we can see that 36 patients completed the full study, that is 12 months follow-up, indicating a good level of adherence and sustained engagement with the treatment protocol. Implication of the study are: clinically, individualized homeopathic medicine as effective complementary therapy for managing pain and stiffness in knee osteoarthritis, particularly for the patients intolerant to NSAIDs or seeking long-term holistic management, as this is a chronic disease and people tend to use NSAIDs or analgesic for this. And what are the side effects of this? It is going to cause gastric problems, or in the later life, it is going to cause renal impairment. So it is better you switch to homeopathy, as it is going to cause less side effects. So the absence of adverse effects makes homeopathy a safe alternative for chronic pain management in elderly and with comorbid patients. In research, further studies should be integrated in objective biomarkers, like we can use inflammatory biomarkers, imaging like CT scan, MRI, and blinded assessments to strengthen scientific evidence. Collaboration between Homeopathic and Allopathic Research Institute could help develop integrated care models of osteoarthritis. Public health, incorporating individuals' homeopathy into community level osteoarthritis management could reduce analgesic dependence and the healthcare burden associated with long-term NSAID use. These are my references. Thank you.
Thank you, ma'am, for that deeply insightful session. Your contributions has truly enriched and strengthened today's deliberations. We shall now move on to our next speaker, Dr. Archana Ingol. The QR code to access all conference photos is available at the registration counter. Please scan at your convenience.
A very good morning to all. The topic for today is a constitutional homeopathic treatment for premenstrual dysphoric disorder in female students aged 18 to 25, a cross-sectional survey and interventional study. What is PMDD or premenstrual dysphoric disorder? It is a severe form of premenstrual syndrome characterized by intense emotional and physical symptoms that occur in the luteal phase of menstrual cycle, typically 1 to 2 weeks before menstruation, and subsides shortly after menstruation begins. Why this study is important is because it shows that a gentle, individualized homeopathic approach can genuinely help young women struggling with PMDD, a condition that significantly affects young women's emotional and academic functioning, but often remains underdiagnosed. It also demonstrates the simple, validated tools like premenstrual symptom screening tool and daily record of severity of problem scale can make homeopathic practice more structured and evidence-based by helping to track improvements objectively. Additionally, this approach offers a holistic, non-hormonal alternative that differs from conventional treatment such as selective serotonin reuptake inhibitors and hormonal therapies which may cause side effects or may not be suitable for every patient. The aims and objectives of this study is to determine the prevalence of PMDD among female students aged 18 to 25 years and to evaluate the effectiveness of individualized homeopathic constitutional medicine in the treatment. And the methodology is study design, a cross-sectional survey followed by observational intervention before and after study. Study population is female students aged 18 to 25 years enrolled in higher educational institution. The total number was 500. Screening phase, all 500 participants completed the premenstrual symptom screening tool to identify moderate to severe premenstrual symptoms. And the diagnosed cases of premenstrual increased moderate to severe premenstrual symptoms students were further evaluated using daily record of severity problem over 2 consecutive luteal phase to diagnose PMDD. Assessment of constitution and remedy selection. Each of the confirmed cases underwent detailed case taking using standard case format. Constitutional analysis followed classical homeopathic framework. Repertorization was done using radar software. Remedies were prescribed in suitable potency and dose and adjusted monthly on patient response and changes. And follow-ups were done for 6 months, and DRSP scores along with subjective improvements were recorded before treatment and again at 6 months. Statistical analysis was done using SPSS software. Descriptive statistics described...
Good morning, everyone. Today, I introduce one of the speakers, Dr. Dinesh R.S. He is a rare blend of experience in both homeopathy and psychiatry with distinguished career dedicated to integrating mind and body medicine into mainstream healthcare. He currently serves as a psychiatrist at Government Homeopathy Mental Health Center, Trivandrum, where he combines his dual qualification to explore holistic approaches in mental health care. Today, he will be speaking on the topic Subjectivity as Data, Rethinking the Role of Emotions in Homeopathy. Here, he will be delve into significance of emotional perception, subjective narratives, and ethic resonance as a valuable clinical data in homeopathic practice, redefining how emotions contribute to diagnosis, prescription, and healing. I welcome you, sir, on the dais. Sir, to enter something.
Okay. Good morning, all. The talk today is titled Subjectivity Data, the Role of Emotions, and the Interdisciplinary Scope. Can you identify those persons on both sides of Hanuman? Yeah, it is Dr. Jenner, who is a father of immunology. The vaccination of smallpox was introduced by him. And the other person is a father of modern psychiatry, Philip Pinel. He introduced humanitarian care into psychiatry. And we can see that Hahnemann was so critical of the psychiatric practices, modern medicine practices during that time, and he advocated homeopathic principle for treatment of mental illness. All these experts, geniuses, were guided by the Enlightenment philosophy during that time, which focused on reason, observation, empiricism, and humanitarian approach to human welfare. One important thought that influenced most scientists was that of René Descartes. He proposed the concept of I think, therefore I am. That is, reason is above everything. Your thought is above everything. So you have to be doubtful. There is a methodological doubting method which is needed for advancement of science. So this was what influenced all further research. So everything which is not clear, scientific, or even if there is a slight doubt, that will be discarded. But recently, another concept, an alternative is also coming up. I feel, therefore I am. Neuroscientists like Antonio Damasio and many others has proposed that this is very important because feeling, the emotional component, is the total human experience. So neglecting this subjective part means that you're neglecting your inner, deepest feelings and emotions. So the important aspect is being neglected by neglecting the subjective data. We can see that a lot of studies have been done in the past. We can see that Charles Darwin proposed the emotion theory, which was evolutionary based, and that emotions are basically innate, and animals and humans all had these basic emotions, and it was needed for survival. And later, William James came to the theory, James Lange theory. He proposed that it is a response to stimulus, and actually emotions are a response to physiological process. So a lot of theories were there. But now, recently, affective science is coming up. Affectivism is on the rise. You can see that there are almost 1 lakh publications over the last few years. 1 million citations is there in affective science. They are mostly studying fundamental nature of emotion, emotion perception, affective neuroscience, and all those areas. And we can see that there are experts like Jack Panksepp, who has studied basic emotions. He has described basic emotions like seeking, play, care, lust, grief, fear, and rage. These are the basic emotions proposed by him after years of study. So what is the difference between feeling, emotion, affect, mood, etc.? All these are important, the minute differences. Affect is a momentary response, while mood is a sustained emotion. So emotion is a stirred up state in the mind, and feeling is a subjective part of it. So all these are variations which are important. And we can see that there are biological networks in the brain which are important for emotions and feelings. There are basically 7 brain networks, out of which 3 are important for emotions and feelings, which is basically the executive function network, which is mostly connected to the external stimulus and planning, execution, everything. And the internal default mode network, which is basically what is going on inside your body, the thoughts, the feelings, etc. And salience network is actually something which switches between both things, which chooses which is appropriate behavior, which is the most important stimulus that you have to respond to. This is a salience network. So all these things are important in emotions and feelings. And we can see that a lot of studies on neurotransmitters are also coming up. And we can see each basic emotions are having different levels of neurotransmitters. We can see that when there is enjoyment, we can see that the serotonin level is high, dopamine level is high, but the norepinephrine level is low. Similarly, there are variations. So that is one way which emotions can be studied. And affective neuroscience emotion theories, in addition to the James Lange theories, these are the newer things, 2 basic contradictory theories on affective neuroscience. One is that emotions are basically innate. The other one is that emotions are basically constructed ones. So where is the link between homeopathy and affective science? In homeopathy, mind symptoms are considered very important. But it is the deepest thing that is in the provings and in the illness. And basically, patients' subjective feelings, emotions, thoughts, sensations, all are reflecting deepest aspects of the patient. So this comes the characteristic symptom of the patient, and they reflect the deepest part. We can see in aphorisms, Hahnemann repeatedly says that the mental condition of patient is altered. And you have to focus on patient's emotional state. And the individual disposition is very important. Even in physical illness, this is the most characteristic thing that will give you the simillimum. But why are we not able to find the simillimum accurately? He also mentions that in the next line, because it remained hidden from the most exact observing physician. If you are also very clearly, accurately trying to observe, it will be hidden from you, because that is the way the emotions and feelings work and is being expressed. So it's very difficult. So repeatability is difficult because all these are subjective elements. Patients hide sometimes their emotions when they come to you. Sometimes even they may be unconsciously not aware about these emotions, but their priority is something else. So many factors will determine how you will find this emotional state during a case taking. So basically, in homeopathy and emotion topics, there is a conceptual overlap. Both are connected with mind-body medicine, and our case taking has a lot of subjectivity data collection, which is very important for finding the characteristic remedy. Even our drug provings has a lot of subjectivity data, which are recorded by so many experts. And we know that during these drug provings, all these subjectivity data were meticulously collected. They had an introspective method to actually collect the feelings, sensation, emotions, and all that. So it's a huge data of subjectivity data. So this thing cannot be ignored during case taking and practice, and also in research. It's very difficult to research the subjectivity elements. But there are objective measurements by which we can study subjective experience. We can see the comparison. The basic neuroscientists have studied that these are the basic emotions. Some of the well-studied emotions are there in affective science, and we can see such rubrics in our repertory and Materia Medica also. So all these can be grouped according to modern scientific classification of basic emotions. So our mind-related symptoms in material medical repertory can be divided into different aspects, even the stressors, the personality traits, the behavior, emotions, feelings. We had a concept that all the mind-related symptoms are in the mind chapter of our repertories. Actually, we can see that many symptoms which are important, sensations, feelings, which are related to mind and is distributed over across all chapters in our repertory. So, which are equally important when we consider the mind and characteristic symptoms. We'll come to that later. Because there is the concept of feeling, which has to be understood in a detailed manner. Basically, evolutionary, there are three distinct stages. The unicellular organisms actually developed these sensations. Before they developed the nervous system, they had to sense for survival with their environment. So there was a sensing going on. And gradually, with the development of multicellular organization, they developed the nervous system and started to feel their environment. And then, with higher evolution, we developed the forebrain, and the prefrontal cortex was developed, and the thoughts and perceptions developed. So the knowing was developed. So what is actually important for homeopathy? What is actually important for healing? Which part do you think is most important for healing? Because illness actually is there in animals, plants, not in only humans. Humans have developed forebrain. But cure means deeper to that. So it means that more than the thoughts and the cognitive part, the feelings and sensations are more important when we consider homeopathic simillimum. So that is the most important thing which we have to focus on. And feelings and sensations has to be revealed. For revealing, the person has to become aware of these feelings and sensations. So it's very difficult to find out which are the most important, deepest sensations and feelings. And this origin of feelings, many scientists like Demasio has said that basically these are from the midbrain, basically periapical gray matter-like areas, where these feelings and sensations are. Even they are linking it to consciousness. Consciousness is not linked to thoughts. Basically, they are basically with feelings and sensations. So such thoughts are there, and the default mode network is being more connected to this sort of feelings. This is one model, the triune brain model. Basically, the reptilian brain has the midbrain areas, and the limbic system was later developed, and finally, the neocortex. So our healing-related feeling sensations are basically the original brain system and not the later developed brain system. And another important thing we have to understand is the interoception part. Even in the drug provings, all the provers had to deeply be sensitive to the symptoms that were produced. All the sensations, feelings, all this has to be collected. This interoception is also neurobiologically explained because our sense organs and perceptions are like the visual, the auditory, the olfactory, all these are sheaths which are with myelin coverage. And what is that? What is the interoceptive nerves where the feelings, sensations are known, actually are devoid of myelin sheaths, and also they are freely connected with the blood-brain barrier. So it is actually more connected with the biochemical nature of the body. So the bioelectrical and the biochemical nature is closely being interacting when we think of the feelings and the emotions. So when we collect the subjectivity data, it captures the full human experience. There is clinical relevance and matching of the symptom with the already subjectivity data which is there in the provings. But there is the problem of bias, error, and all that. So how can we reduce this? By combining the psychometric tools like the positive and negative affect schedule, there are many tools like that. We can also use fMRI like physiological markers, newer technologies can be there. And there is a method called ecological momentary assessment, which is a natural data collection of the emotions and feelings by using of newer apps. So all this, there are different techniques by which subjectivity data can be collected and which can be linked both with drug provings and also when we give a medicine for a problem. So this can be brought into more objective component by translating the subjective part with the newer tools. So for homeopathy, it means that there is a sharper operationalization of the simillimum concept. There is enhanced reliability of remedy selection, and it is a step toward interdisciplinary legitimacy. For example, if you consider one basic emotion like anger, there is an application of an emotion. One application is irritability. You can see that many drugs are there for irritability. Naxomica, chamomilla, a lot of drugs are there. But how do you identify this irritability in a patient coming to you with a clinical problem? Suppose that there is a renal colic. The patient is highly irritable. How do you identify it? So this has a neurobiological component. Why is this patient being irritable? It is related to frustration. It is related to block goal attainment. It is also related to approaches of threat. And certain areas are working in this. There is a dysfunction of the amygdala, medial prefrontal cortex, and the association areas. So we can see that there is a role in healing for this concept of understanding this emotional state variations in the patients. So we have seen that chamomilla and irritability is very much connected, and I will present a case with congenital leukemia where this was identified. You can see a 3-month-old child presenting with leukemia. It was diagnosed as AML M5 variety, and it had a total count of more than 1 lakh. The different neutrophil count was less than 1%. And the child was very irritable. It was refusing to feed, and he had to be carried along to reduce the crying and irritability. And there were reddish nodules all over the body. So initially, chamomilla was prescribed, and you can see that after a few days, the child was calm, started feeding, and reddish nodules disappeared. Later, it was followed with R-sided carcinosin and calcarea fluor. The child was better. After 4 months, they said that the milestones were going on normally. The count came down to 32,000, later to 12,000 and 4,000. The RCC had advised palliative chemo, and the parents actually didn't give that, and they resorted to homeo medicine. And later, they were also given Ayurvedic medicine. But the initial response to chamomilla was so striking. The patient was so irritable, and after giving chamomilla, it calmed down, it started feeding, and gradually the reddish nodules disappeared, and the blood count changes were noticed in the next few weeks. So you see, even in cancer, the emotional state, altered emotional state, even if it is a 3-month-old child, it is an infant. So there is no question of placebo effect. So all these things has to be studied, no? And in cases of renal colic, multiple times it has been found that instead of giving berberis, hydrangea, and all that, if you can give Naxomica, chamomilla according to the emotional state, the pain comes down very fast. So it can be used in emergency situations also. So the emotional state is more important than local and particular symptoms. And chamomilla is also seen effect when there is allergic rhinitis, bronchial asthma, when the emotional state of irritability is seen. And in mood disorders like mania, intellectual disability, disturbances, all these conditions, chamomilla gives excellent result when this emotional state alteration is considered. Another important emotional state is the grief state. It is actually a response to loss. And there are various stages like anger, bargaining, finally accepting the situation. But Ignatia is one important drug that is very useful for this grief stage. I'll mention a short case. It was a 68-year-old retired college professor who had presented with the lichen planus, and she was given Ignatia because of the grief she had following 2 deaths in her family. And the most important thing was later she brought her brother who had a cluster headache, which was with severe pain, and which he had to resort to oxygen supplementation from the Srijitra. After giving so many pain remedy, there was no result. So here, actually, after initially giving carcinosin, Tuja and all that, finally Ignatia had to be given. He earlier denied that he had no grief, but his son had committed suicide a few years back, but he denied that he had that grief. So there is a silent grief. So in both this brother and sister, the stressor was a silent grief and a suppressed grief. And the individuals, one was a male and one was a female from the same family. They presented with two psychosomatic complaints, entirely different. One presented with lichen planus, one presented with cluster headache. So one actually denied grief, one actually revealed grief with crying in front of the physician. So this sort of difference in presentation, in the formation of psychopathology, and the psychosomatic symptom, both these medicines were relieved with Ignatia. So that emotional component was very important, and which is it was very evident in the female case. It was very difficult to find the emotional state in the male state. Another one is ambivalent effect. How many minutes I have? 5 minutes? Okay, I'll finish it. So this is a case of ambivalent effect. So there are so many ambivalent effects present, because the effects like nostalgia, all those things are bitter sweetness, all these are ambivalent effects. Schizophrenia, basically, the effect is actually not so prominent, but if there is, in anacardium cases, we can see this ambivalence very prominently. One case which was being treated with clozapine actually presented this auditory hallucination, and after prescribing anacardium, this auditory hallucination came down. And when I probed more into the content of the auditory hallucination, he was saying that the voices used to tell in two meanings. So this thing is very clear in anacardium, the duality. So the ambivalent process was there in his mind. And in addition to duality, hearing voices and cruelty are three other important domains of anacardium. So we can group it into affective, emotion, cognitive, behavior, and symptoms and signs which are perception and thought related. So all this can be grouped. And the anger is very high, there is severe cruelty, and the hallucinations and delusions have a duality component and an ambivalent component. There are other cases in which, how do you find this constitutional medicine? Because they also have this emotional component. Arsenic alb has this great mental restlessness. Very often we fail to find this great restlessness part. So there was a case of delusional parasitosis in a mild cognitive impairment case, and he resorted to antipsychotics with no effect. But after giving arsenic alb, on the next visit it was completely symptom-free. So the prescription was basically done on this mental restlessness. That was the emotional part which was used for prescription. And in modern science, modern technological advances are there. We have to resort more to technology in order to get this data analyzed. So we have artificial intelligence coming up, we have supercomputers coming up, even quantum computing is coming up. So this huge data involved in collecting this subjective material and in analyzing all this system biology part. It's very difficult for human individuals to do it alone. So it needs a huge collaborative effort utilizing all this technology. So only then an integrative health system can be developed, and homeopathy can have a good role by making others also convinced about what is the actual role of this. So the central part of homeopathy is basically the emotions and feelings, and we have to give importance to that subjective elements. So both in drug provings, we have to actually include technology to measure the subjective data in a more convincing manner. In the same manner, in the clinical process also, we have to include technology which can be used to measure in a better manner. So actually our simillimum can be reframed as an early model of individualized affect-sensitive medicine, because that is the deepest part of human experience. That is the most important thing which Hahnemann has explained, and the homeopathic principle of simillimum actually is basically dependent on this characteristic symptom and this individualistic differences. So interdisciplinary research linking homeopathy, affective science and subjective methods are very important. This was a drawing of one of my patients. You can see art is an expression of inner thought, sensations and feelings. So this is also, we won't get this from there simply by observing them or by case taking in a routine descriptive manner. So there is something going on inside them. So those sensations, feelings, which are basic to them, can be brought out by different techniques. So we have to explore more on this and match it with what is available in our compiled data, which is present in the human drug provings. So this is my references. Thank you.
Thank you, sir, for that insightful and thought-provoking session, beautifully highlighting the significance of emotions and subjectivity in homeopathic practice. May I now invite Dr. Asha Kiran, consultant, founder, Precise Homeopathy, Queensland, Australia, to present the certificate as a token of our gratitude to our esteemed speaker, Dr. Dinesh R.S. Thank you, sir. Thank you, ma'am. We now move forward with the session. May I request the chairperson to introduce our next speaker.
Dr. Farhan Jamir, PhD, postdoctorate in USA, Professor, Department of Ayurveda Pharmacology, Dravaguna, Chief Scientific Officer at Alwaz Ayurveda Medical College, Mudbedri. Dr. Farhan Jamir is distinguished biochemist and Ayurvedic pharmacologist with over 16 years of teaching experience and 19 years of cutting-edge research experience in microbiology, biochemistry, and integrative medicine. A recipient of the prestigious Sir C.V. Raman Fellowship from the University Grant Commissioner, Government of India. Today, Dr. Farhan Jamir will present on the topic Pathogutomics, further of microbiome in holistic healing, where he explore the emerging science of gut-brain immune axis through a molecular lens, illustrating how microbiome modulation could revolution for further of holistic health and personalized medicine. I welcome on the dais, sir.
Ellargu namaskara. Ellargu namaskara. Okay, a very good morning to everybody. I see that there is a serious audience, and when I look at you people, I feel that science is so scary. Okay, because when I see from this particular podium, there are so serious faces that a war has been declared, and you are the only Homo sapiens who have been left out, and now you are an untrained army, and out of this door there's an the mammoth of other enemy army, and we need to go and fight with it. So that is the kind of seriousness what I see on your faces. Ladies and gentlemen, to make sure that your entire focus will be on me for the next 20 minutes or maximally 25 minutes, I have made it a point that I have not even bought a PPT with me. Okay? Because the moment we have an additional aid in pedagogical component, it has been felt that 50% of the resources are being hijacked by your PPT. So I am a well-designed Homo sapien by the God. Okay? So I have my voice box, I have my head top, wherein you consider a laptop, I have my head top. Okay? And hence, with that, whatever little I was able to get with my experience from the last 20 years, this has been brought to the podium for the next 20 minutes. Will you be with me? Okay, I'm happy that you respond. I also request your neighbors to pinch and see whether the person is breathing. Please pinch, go, pinch. Very good. Now, I'm so happy that everybody are poking with the person who is sitting next to them. This is because, again, in my talk, I will make sure we'll have that 10 seconds of fun and another coming back session of another 50 seconds. So, that modulation would be like 10 seconds of masti and another 50 seconds of real learning. As we grow older, or as we acquire more knowledge in terms of classes, in terms of degrees, in terms of all laurels, whatever we do, what we have done is slowly, we have killed the child in us. This is a very, very serious thought, what I'm trying to tell you. This has been done either because of your personal environment at your home or at a professional environment which has been given at your college. You need to agree with me. Your dad or mom will say, hinge kutkumbeda, hinge tale bachu, inta batte haku. So, you have been instructed. In the same way, when you go to a professional system, wherein what we call it as a school or a college or a university, it's been said that artha aglilva, ratify it. Okay, if you have not understood it, because your intelligence is only measured on, or it is directly proportional to the marks what you score. So that number will define your intelligence. ಎಷ್ಟು ಅರ್ಥ ಮಾಡ್ಕೊಂಡಿದ್ಯಾ ಅದನ್ನ ಯಾರಿಗೂ ಬೇಡ. Okay, so I just want to mimic whatever is there in a textbook and reproduce it on an answer script. That is the entire intent, and that will define my intelligence. Trust me, my dear friends. I normally don't give my CV so that, when a speaker has been introduced, I also know that there are a lot of students. A great wall of China has been built between the speaker and the audience. And for this reason, I make sure that my CV has not been read out. Okay? But on the other way, what I'm trying to make you understand is, I have the same equal opportunities what you had, or what you have, and what you will have in future. Okay? The way you utilize it makes a difference. The way you utilize it will make a difference. Now, coming on to the today's, important component. The first thing what I want you to remember is, throughout this next 18 minutes, have a smile on your face. Everybody, have a smile on your face? Good. Okay. The second important thing is, keep the child in you alive. Because all these days, now with all science and technology, ICMR, DST, DBT, CSIR, everybody are talking about innovation and creativity. I cannot innovate or create with dead people, or people who are pretending to be alive. So hence, you need to be alive if you want to innovate or create something. And these kind of conferences are the platform to kindle your creativity and to tell you that, yes, you can think more. All these days in our schools and colleges, we have been taught that sky is the limit. You agree with me? Say yes or no, yes? Yes. What is the limit? Sky is the limit. And today I tell you, my dear friends, sky is not the limit. Because above up, there is even something higher above up. I will repeat this once again, though it is not that grammatically right, but I want you to take the essence of it. Okay? Above up, and remember this for your lifetime. Above up, there is even something higher above up. So that means to say sky is not the limit. That's my point. Okay? This is another take-home message what I want you to take. Now, my previous speaker, Dr. Dinesh, he has well illustrated about all the concepts of whatever I wanted to speak. And I'm happy saying that, Abba, I did not repeat the slides. Otherwise, sir, copy madirbodu, plagiarism. Okay, that could be another condition. So, the PTK or the preamble of my talk has been already set by Dr. Dinesh. And here I bring onto a podium few questions. And if you are able to, I am not looking for answers. If you are able to think in that particular directions of the question, I'm happy for my 20 minutes or 25 minutes, what we have spent together. The first question starts like this. Sir, what's your name, sir? Sachin, sir. I was just sitting next to Sachin, sir. Okay? I am seeing Sachin, sir, for the first time. Sachin, sir, is also seeing me for the first time. I did not take away his father's property. He also did not take my father's property. But for some reason, my dear friends, I hate Sachin, sir. Not just because he's sitting next to a beautiful lady, but on that way, for some reason, I hate Sachin, sir. Okay, now, why? Why? Point number one. This is the case number one. Again, I will go back to the same Sachin, sir. Okay, again, he has not done anything, I have not done anything to him, but for some reason, I am in deep love with Sachin, sir. I have two scenarios. Now, at your age, who are like, 18 to 25 or 30, at your age, this kind of an intuition normally happens. It happens. If it is not happening, then there is some hormonal deficiency. Okay, it should happen. It should happen. That means to say that your body is normal. Now, to make you understand, why is that? Normally, you will, most of the students, you are able to correlate it. You come from various backgrounds, various fraternities, and then, a female comes, there are two females in the classroom, and these two females are meeting for the first time, and this one female says, Abba, a hudgi, just irritating. I hate that particular female. Have you observed this? Okay, now what might be the reason? I will not tell you the answer. Okay, the thing is, I want you to think, okay, because, there is no background to this particular thing, but on the way, it is biology which has the answer for it. This is point number one. Point number two, okay, this is another scenario. How many of you who are sitting here are being born via a normal delivery? Okay. How many of you are being born via a rooftop delivery, what we call it as C-section? Okay. Now, if I want you to observe this. Now, by any point of time, you are born as a normal, through a normal canal, and your brother or a sister, if he or she has been born through C-section, what difference have you seen? What difference have you seen? The first point, people who are born with C-section, they have lesser immunity. I give a very big statement. People who are born with, they are like, ha, now I know, yake nin moogal yavaglu gonne barta ittu anta. Okay? People who are born with C-section are, okay, they have lesser immunity. But however, they also have an advantage. People who are born with C-section, okay, they are a bit intelligent. But however, these intelligent people cannot handle stress. So, next time when I study, I will get a first rank, but if I don't get a first rank, I will get depression. This is the scenario. Whereas, normal delivery people, okay, normal delivery kids or the babies, they are not that super intelligent, but however, they're consistent. They are consistent. In terms of their health, they're very strong. In terms of ashtu bega sita jara agala. Okay, so they are consistent. Okay, however, when they study something, they require a second attempt to understand that particular concept. Okay, and when they fail, they're resilient. They will not think about depression. Okay, that's the logic. Okay, now, can you tell me why is this happening? Okay, the answer for all this, both the scenarios, is nothing but your microbiome. Your microbiome. That means to say, you are being driven. You think that, you drive yourself, but on the way, there's an entire universe of microorganisms which are actually navigating your future, present, and past. Okay, future, which will navigate your future, current thing, which is present, and also your past story. Now you will say, sir, when I was not even born, how is this microorganism navigating my future? I don't understand this. Let me try to give a justification for this, my dear friends. Now, to understand this, I need to understand what is a microbiome. What's a microbiome? What's a microbiome? Remember, I don't want to give very tough definitions so that nobody understands it, but on the way, microbiome is a sum total. 7th standard ali summation anta barita idralva. So it is the sum total population of microorganisms which are residing inside me, on me, or inside me. Okay, what is the microbiome? It is the sum total microorganisms which are residing on me or inside me. These are called as microbiome. This family is called as microbiome. Now, for you to imagine what exactly is a microbiome, I want you to think as a bacteria. What are you? You are a bacteria, and now you have a house. And on a house, you have a terrace, and on a terrace, you are sleeping as a bacteria. And then looking onto the sky, and there is so many things on the sky. That happens to a bacteria when it is in your gut and when it is looking upward into your system, wherein there are so many things which are fascinating, which have been coordinating with that particular microorganism. So, what is microbiome? Coming back, it is the sum total microorganism which are staying there. When I say sum total, give me examples. The examples could be, this could be a consortium. It could be a group of bacteria. It could be a group of fungus. It could be a group of viruses. It could be a group of parasites. It could be a group of nematode, whatever. So, there are again, fights. There are friends and there are enemies. These microorganisms, these microbiome can be classified into two major types. One is, this group will be the friend microbiome, and this would be the enemy microbiome. I'm sorry, but on the way, we'll just consider this as good and bad. So this is a group of good microorganism, and this is a group of bad microorganism. Now, in this particular auditorium, there are around 1,000 people. Okay. Here, when I talk about microbiome, I am talking about not the entire microbiome, but I am just referring to the bacterial microbiome. I'm referring to what? Bacterial microbiome. And if you tell me, sir, please tell me how many numbers of bacterial microbiome are there in my gut, not in the entire body, just in the gut. The number is 10 to the power of 14. The number is how much? 10 to the power of 14. For people who does not understand 10 to the power of 14, which is again mathematics, yake biology tagondidira PUC alli? Mathematics alli weak idde sir, adike biology tagondirodu anta. So, for people who have no idea of what exactly is 10 to the power of 14, 10 followed by 14 zeros is the total number of bacteria which are just present in your gut. And these bacteria which are sitting here in the gut, they are controlling your brain. They are controlling your brain. That means to say, for my emotion, I have, my bacteria is responding. It is sending a chemical to my brain. I'm so happy. Okay, again, bacteria sending a signal. So, for anything, for an anxiety or a depression, for my laughter or my cry, for everything, what is responsible? Microbiome is responsible. Did you get this? Now, as you as clinicians, I know that, the cameraman is having the tough task because there it was normally fixed. Now I am moving around. At least this speaker adu namge iga kelsa kodta idaralla maraya anta. Okay, so, coming back, so I have the microbiome which plays a very important role. Now you as clinicians, now you need to tell me, I want you to talk to your friend. I have two patients with UTI infection, urinary tract infection. One is a male and the other one is a female. Now you tell me, and both are getting the infection for the first time. You tell me which kind of infection in what gender is easy to treat. Have a discussion for 10 seconds. Have a discussion. Go talk. Hello, talk. Ten seconds are over. Okay, now tell me the answer. Male is easier to treat. Great, but wrong answer. Okay, now female is, female UTI is easy to treat. Male alli UTI bantu anta helidre arda kaalu gundiyallide anta tilkoli. Okay, ashtu kashta ide. I'll tell you the reason also. Now, in the entire body of mine, I have acid. Okay, so in males, I have acid only in stomach. Where do I have acid? Which we call it as hydrochloric acid, which is only present in stomach. Whereas in a female body, hydrochloric acid is being secreted by two different components. One is in the stomach for the digestion, and the second is into the vaginal canal. Okay, you have the HCl. Now, the entire environment into the vaginal system is acidic in nature. So, in terms of microorganisms, when I think, what kind of microorganism can stay there? Microorganisms which have the capacity to withstand acid. Absolutely true, ma'am. And those set of microorganisms are called as acidophiles. They are called as acidophiles. So, automatically, basophiles and neutrophiles are being washed out because they are not able to withstand that particular environment. Whereas in male human, there is no acid into the urinary canal. Okay, so what are the microorganisms which can inhibit or which can, flourish? It is acidophiles, basophiles, and neutrophiles. In this particular condition, if you want to give a treatment, then you need to look into 3 different criteria for killing 3 different types of population of microorganisms, whereas in females it is only 1, and hence this is being understood by industrialists or entrepreneurs, wherein a simple solution such as V-wash is simply sufficient to kill or to prevent UTI, wherein V-wash will not work in males. Did you get the logic? Okay, the point what I'm trying to make you understand is, understand your foundation. We talk everything about, all hi-fi, but on the way, we have forgotten our foundations. Again, going back to the story of microbiome, if I shake hand with somebody, with Sachin sir, my dear friend, okay, if I shake hand with them, he might think that physically we are shaking hands. But remember, the interaction is in terms of 3 levels, what I call it as PPP. First interaction is physical. The first P is physical. I shake hands. The second P is physiological. When I shake hands, there is good hormone which has been produced in my body, hence that is physiological. This hormone can create a good impact in my brain, and hence the third P is psychological. So whenever I interact with another human being, that is, I am having what effect? PPP effect, that is physical, physiological, and psychological. Now, when I say that Sachin sir is a good friend, all these 3 will get aligned. When I say Sachin sir is my bad friend, again all these 3 will get aligned, but with a negative vibe. So what am I trying to make you understand? This component, every component of yours will affect your sum total microbial population. Every action of yours. You waking up early will affect your microbiome. You eating junk food, I'm sorry, there is nothing called a junk food. All good food has become junk because of your habits are junk. Lace, eating 1 lace, eating 2 lace is still good. Eating 1 packet of lace is bad. So it was your habit which has made a good food as a junk food, but nature has not produced something as bad food or a junk food. You agree? Mettige haudu sir. ರಾತ್ರಿ ಓದಬೇಕಾದ್ರೆ ಪಕ್ಕ 12 ಗಂಟೆಗೆ ಬಟಾಣಿ ಹಿಡ್ಕೊಂಡು ಕರುಮ್ ಕುರುಮ್ ಚರುಮ್ ಕುರುಮ್ ಅಂತ ತಿಂತಾ ಇರೋದು ನಿದ್ದೆ ಬರಬಾರ್ದು ಅಂತ ನಿಮಗೇನು ಗೊತ್ತು ಅಂತ. ಬಟ್ ಆನ್ ದ ವೇ, ಫೈನಲಿ ಇಟ್ ವಿಲ್ ಲೀಡ್ ಇನ್ ಟು ಬ್ಲೋಟಿಂಗ್, ಇಟ್ ವಿಲ್ ಲೀಡ್ ಇನ್ ಟು ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಅಂಡ್ ಆಲ್ ದೀಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಡಿಸ್ಫಂಕ್ಷನ್ಸ್ ವಾಟ್ ಯು ಆಕ್ಚುಲಿ ಟಾಕ್ ಅಬೌಟ್. Done? Okay. Now, I also want to enlighten you that how exactly your gut microflora can affect your total health, and how can I use this as a diagnostic marker. Now, trust me, dear friends, I have my fingerprint, And I say that, over my mobile is more secure because it opens only with my fingerprint. When we look into a big data analysis, 10 people in the entire world, they match. Your fingerprint matches with 10 people in the entire world. Your fingerprint matches with 10 people in the entire world. That means to say it is not unique. ಇನ್ನು 9 ಜನ ಅಲ್ಲೆಲ್ಲೋ ಮಾರ್ಕೆಟಲ್ಲಿ ಇದ್ದಾರೆ, ಅವ್ರನ್ನ ಹುಡುಕ್ಬೇಕಷ್ಟೇ, ಹುಡುಕಿ ಕರ್ಕೊಂಡು ಬಂದ್ರೆ ನಿಮ್ಮ ಮೊಬೈಲ್ ಓಪನ್ ಆಗುತ್ತೆ. Agree? Okay. However, so now that means to say your fingerprint is not unique. The second important thing what people are looking for is your iris scan. Now if you go to NCSM or when you go to all, NMC, etc., they say scan your iris. There are 3 people in the entire world wherein your iris can match. So that means to say your iris is also not unique. But however, there's one thing in your body which is absolutely unique. That is nothing but your gut microflora. Your gut microflora, anybody in the entire world, you bring anybody in the entire world, any human in the entire world, the gut microflora will not match with, even if that particular person has been born with a Siamese twin. Forget about other people. Even if the person has been born with a Siamese twin, they're still attached to each other, but on the way, his gut microflora is entirely different, my gut microflora is entirely different. So, what I want you to appreciate is, in the morning, on the commode, what goes outside is gold. That's the unique material. Today you might, oh sir, this is nasty, and oh no. But on the way, that will tell you the status of your health. This is where the entire medical fraternity, especially in terms of diagnosis, is actually looking for. Because when I go to a person, if somebody is diabetic, if somebody is having cancer, I do not want to prick. Already the patient is under trauma. I do not want to prick and take 5 ml of blood, 10 ml of blood. So now what people are trying to do is, they are trying to understand the feces, the saliva, the tears of the eyes, the sweat, and then analyze what is actually happening into that particular patient. So these are the non-invasive methods for diagnosis. Now you say, sir, how is your microbiome related to diagnosis? Again, we will throw light on it. Now, when I said that I have my gut, and remember, science has now called your gut as a second brain. So human does not have just one brain, human has 2 brains. One at the top and the other one is at the midgut. That's your stomach or your intestine, small intestine to be very precise. Clear? So, certain peptides, when I talk about neuropeptides, what do you mean by neuropeptides? Which control these are the small proteins or peptides which will control your brain. They are called as neuropeptides. And where is the location of this neuropeptide? It should be logic. It should be in the brain. But however, the speciality is all these neuropeptides are produced in your gut and then traversed and then it goes to your brain. So the production unit is your gut, and hence whatever is necessary, the raw material which is necessary, the precursor molecule which are necessary are produced in your gut and then travels to your where? Brain, into your brain by a road. And this road is called as gut-brain axis. This road is called as gut-brain axis. Now, this connection is not only to the brain, this connection is to your liver also. So that is called as gut-liver axis. It could be gut-pancreas axis, gut-lung axis. So, what I'm trying to make you understand is, this is the major junction. This is your toll, or this is your junction. Through this junction, all your organs are interconnected. Everything has been controlled. So, you keep your gut healthy, all of your organs are, healthy. This is what now people are trying to say with a newer terminology, which is called as biohacking. We know something about hacking. I hack your computer, that is called as hacking. I enter your computer without your permission, that's called as hacking. But on this way, this is a technology, what I call it as biohacking, wherein people are trying to know, when will I die? What is biohacking? Because everybody has money, everybody has resources. The only thing what should not happen to me is, I don't want to die. And hence, people are trying to tell you, your jataka, your astrology, saying that what would be the probable time when you will die biologically. ಅದು ಬಿಟ್ಟು ಟ್ರೈನ್ ಕೆಳಗೆ ಹೋಗ್ತೀನಿ ಅಂದರೆ ಯಾರು ಏನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ಬಸ್ ಕೆಳಗೆ ಹೋಗ್ತೀನಿ ಅಂದರೆ ಯಾರು ಏನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಬಟ್ ಆನ್ ದ ವೇ, biologically, when exactly you would die can be measured. I'm a great fan of homeopathy. Okay, and that's the reason, because I have no degree in homeopathy, I have nothing to do with homeopathy, but on the other way, I have seen only two components in homeopathy. One is the cause and the effect. Okay, so I have seen how exactly you diagnose certain things, and I see that with that beautiful white color pearls, okay, how exactly you can treat it. But on the other way, what is actually painful is if I ask any person, this is fine, 0 is okay with me, 100 is okay with me, but what exactly the root, what exactly the mechanism, that part says, sir, that part you don't ask. Okay, so hence, this is an open call to tell you that we are here to get integrated. On Dinesh sir, on the last slide, he says that there's an integrated technology which has been required in terms of systems biology. This is what he was trying to mean. Government of India is pushing a lot of money to establish mechanism of action for most of the traditional medicines, okay, wherein we know the effect and let the grassroots level people get the benefit out of it. And for that to happen, I need to have patents, I need to have scientific evidence for my particular drug, and that could be only generated through publications, patents, and products. That is again PPP. Publications, patents, and products. For me, if, Acharya sir has to believe me, the only thing is, we are being connected emotionally, that's a different story, but he will say, Zamir, show me the document. And that document comes from this PPP. Please remember, my dear homeopaths, all my dear friends, you are the architects of a future good, healthy life. Okay, if I want to be healthy, if my kids want to be healthy, if my family wants to be healthy, without the ingredients such as chemicals, such as synthetic molecules, etc., we are seeking help. The only point why I am standing on this podium is not to tell that I have done this much, but to ask help, to tell that, future is in your hands. Okay, you are the brand ambassadors of homeopathy. It is on to you. Okay, you know the entire composition, you know how to prepare a drug, you know its head and tail. But the only thing what we need to kindle and again re-establish is what exactly is the mode of action. If we are able to tell this one point with any simple drug, world is ours. I bet you world is ours. Okay, I have also seen, death. How did I see death? The entire profession of mine was I was working as a neuroscientist at US. I was working on dead tissues. But these dead tissues should be extracted just 6 hours after the death. So I was literally waiting for my patients to die. Because I felt that death is a much better option than living. Because my patients who were working on, who were there on the bed, they were patients with MS, multiple sclerosis, a condition, a neurological disorder which is called as multiple sclerosis. The bad thing about this disease is the person will not die. He will only suffer, and he will suffer slowly, part by part, his organ will get paralyzed. Okay, and then the only thing is he will not die. And for him to die, it takes around 20 years. And in that 20 years, you will see the reality of life. Your parents, they will not come, they will not show up. Your kids will not show up. The only person who will show up is the doctor and the nurse. Okay, and hence, it is not just you give a treatment. There's an empathy and sympathy which is required towards a patient, and you are the people who are able to show it. Okay, concluding remarks. Okay, now in terms of microbiome, how exactly I can use it as a diagnostic marker? These microbiome are responsible for producing certain short chain fatty acids, what we call it as CSFA, short chain fatty acids. Now, these short chain fatty acids are very, very unique for a kind of microorganism. Example, if I have cancer, so the short chain fatty acids which have been produced are entirely different. If I am obese, the kind of microorganisms, short chain fatty acids which have been produced is entirely different. So I can use this as a diagnostic marker. But how do I analyze it? I can analyze it in 2 different methods. One, I can take up the feces or the stools and analyze it. You would laugh at me. This science is already established, and this science of diagnosing a particular disease using the stool sample is called as poopology. This science is called as the material is called as poop, and the science is called as poopology. Great, scope is there in this poopology. One. If I don't want to touch the feces, the other option is there's something which is called as, pardon me for this, there's something which is called as fart analysis. Okay, so these short chain fatty acids, when they release in terms of volatile aroma, and hence, when somebody farts, there is a smell. Why is this smell? This is mainly because the gut microorganisms are trying to ferment a particular component, and there is a special kind of short chain fatty acid which has been produced. And depending on this particular smell, I can tell what kind of a disease are you suffering with. The same is the technology which has been bought in as a blow test. You come and you blow into the machine. It's something like, on a Saturday or on a Sunday, all your cops, they become detectors. All your police wala, they will become detectors. Blow, blow, blow. And when you have the, usre barala pavaga. Okay? And you like, jora blow madi. Okay, so all this is nothing but the final technology, okay, wherein you are able to detect alcohol. Correct? So, when I can detect alcohol, I can also detect various other kinds of metabolites, which I call it as short chain fatty acids, and this would be your diagnostic marker. Now, the final statement is, I do not want to give tablets to my patients. I do not want to give chemical tablets to my patient. I want to give a cocktail of microorganisms when I know that when I have a disease, and for that particular disease, the microorganisms are responsible, I can still give a cocktail of good microorganisms. I told you, I divided that. Okay, so remember, when there is a balance between good and bad, that condition is called as normal. Your body is functioning normal when it is good is equal to bad, that is called as normal. When the bad component increases and good component decreases, that condition is called as dysbiosis. That condition is called as dysbiosis. However, with an intervention of a drug, bad bacteria or bad component will go down and good component will re-establish. This is called as eubiosis. I want you to remember these particular three terminologies, which is biosis, dysbiosis. Sir, love you for your attention. Okay, he's writing, he's listening, okay, and he's responding. That means to say, sir is alive. Okay, so when he is alive, I'm sorry with his age, but when he is alive, nimige enta roga agideyappa. Enta agide. So we need to learn. It is not just, you be alive. Try to be receptive. The problem with our students is when they come to the college, they bring a very small tea saucer. Sir, this saucer ivattu tumbudi, ishtu knowledge is saaku, sir. I request you, my dear friend, bring big trucks. Tell your faculty, fill this truck. Only when you fill the truck, I will go home. Otherwise, I will not go home. Now, if your entire need is only this much, then what will the faculty do? Please remember, all your faculties are like, great 7-star chef. They know to cook everything. Everything is on a buffet. But on the way, it is you who has to eat it, who has to taste it. Otherwise, the entire dish which has been prepared will just go as kaput, will just go as waste. Okay, so it is on to you. It is not just, I don't want to bring in lot of concepts and, try to give jnana on it. The only thing is, for being a good homeopathy doctor, change your attitude. Have sympathy, have apathy, and look for the new technology. You remember, how many of you in the hall use a phone which is called as Nokia? 1, 2. Others, Samsung? Ma'am, it's me phone, you phone, iPhone. Okay, so all these things. I still have one exception. This is one exception, but most of you will carry Samsung. Now, the first builder was Nokia. But however, why did Nokia go away? Only 5 people are using it. This is because Nokia did not get upgraded at right time. So the only thing is, if you want to stay relevant, okay, because you will be spending your 5.5 years. If you want to stay relevant, be updated. Be updated. Otherwise, you will blame your faculty, you will blame your college, you will blame your system, you will blame the Homeopathy Council, apart blaming from yourself. You will never blame yourself. Nanu odlilla, adikke nanu uddara aglilla, ಇವರೆಲ್ಲರೂ ನನ್ನ ಭವಿಷ್ಯ ಹಾಳು ಮಾಡಿದ್ರು ಅಂತ ಮಾತ್ರ ಹೇಳ್ತೀರಾ. So just make sure it is you who are responsible for your future because you are your own architect. Thank you very much for your patience hearing. Thank you very much.
Thank you, sir, for that enlightening, energetic session, offering a futuristic and holistic perspective on the microbiome and its transformative role in healing. May I now invite Dr. Joshna Shivaprasad, HOD, Department of Pediatrics, Father Muller Homeopathic Medical College, To present the certificate as a token of our gratitude to our esteemed speaker, Dr. Farhan Zamir. As we continue, may I request the chairperson.
Last sentence. I just want to say thank you to everybody in two different formats. One is a longer format, which I will take like more than 2 or 3 minutes, and a short format, which will take 30 seconds. The management, the organizing committee, especially Indu ma'am, who was one of our Alvas faculty, Archana ma'am, who was again our Alvas faculty. They are the people who said to the organizing committee that there is one organism there at Alvas. Okay, so otherwise I had no opportunity to come and stand in front of you. Meeting you people, I am blessed. I'm so happy. I'm thrilled. All my dopamine and serotonin levels are so high. If you tell me to jump over from the Mount Everest, I will do it now, because that's the high, that's the kick what I have got. Thank you very much. Very importantly, the principal, Dr. Prabhu Kiran sir, who had made it a point that I talk at various platforms, but on the other way, he had made it a point that 3.5 months ago, he has sent me a document saying that you have been booked and this particular date is already booked for me. Okay, that kind of a preparedness requires a lot of leadership skills. Okay, so I thank the principal and his entire faculty, including Anil sir, who had called me today and saying that, sir, PPT bekittu sir. And when I said PPT illa, he was like, enta martya marya neen ivattu bandu. Okay, so that was the concept. But Anil sir, so thank you sir. You were upset on the phone, but I'm sorry for that. Okay, finally, I am married for the last 10 years. Okay, this is the first time my wife, my Ardhangini, okay, my Sarathi, okay, Dr. Kaunen Khan, who is an Ayurvedic doctor with MD, PhD, etc. So she has come and witnessed me. ನನ್ನ ಹಸ್ಬೆಂಡ್ ಬೆಳಗ್ಗೆ ಇದ್ರೆ ಎಲ್ಲ ಟಾಕಿಗೆ ಹೋಗ್ಬೇಕು ಅಂತ ದಿನ ಬಟ್ಟೆ ಎಲ್ಲ ಏನು ಮಾಡ್ಕೊಡ್ತೀನಿ, ಏನು ಮಾಡ್ತಾನೋ ನಮ್ಮ ಹುಡುಗ ಗೊತ್ತಿಲ್ಲ ಅಂತ. ನಿಮ್ಮ ಹುಡುಗ ಇದೇ ಮಾಡ್ತಾ ಇರೋದು ಮೇಡಮ್. ಓಕೆ, ಸೊ ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಫಾರ್ ವಿಟ್ನೆಸಿಂಗ್ ದಿಸ್ ಆಫ್ಟರ್ 10 years. ಥ್ಯಾಂಕ್ ಯು.
Thank you so much, sir. As we continue, may I request the chairperson to introduce our next speaker.
Dr. Asha Kiran, consultant, homeopath, alternative medicine, researcher and medical educator, founder, Precise Homeopath, Queensland, Australia. Dr. Asha Kiran is accomplished homeopath consultant, researcher and educator, over 25 years of international experience spanning clinical practice, public health and medical education. She is the founder of Precise Homeopathy in Queensland, Australia, and has worked extensively in government-led health promotions, chronic diseases prevention and indigenous community health projects under Queensland Health. Today, Dr. Asha Kiran will present on the topic Objective Structured Materia Medica Examination, a competency-based framework to enhance homeopathy education and practice readiness, where she will explore innovative educational methodologies designed to strengthen homeopathic competency, assignment, and clinical prevalence in the modern era. I welcome on the dais, madam.
QR code to access all the conference photos is available at the registration counter. Please scan it at your convenience. QR code for the feedback for EXPLORA 2025 will be displayed now on the screen. Kindly do fill in your valuable feedbacks.
Good afternoon, everyone. My name is Asha Kiran. I have experience of a structured competency-based education for last 14 years, and that has helped me in Australia in a school of medicine, and that has helped me develop the same competency-based education for Materia Medica, and we'll call that OSME. But before I start, I wanted to thank the Father Muller's Homeopathic College, especially Dr. Prabhu Kiran, who's given the opportunity for something so spectacularly new. And this is the first time we will be, yesterday was the first day we even tried it on. And thank you, Dr. Saviona, for helping me do the workshop yesterday. And with the moderator's permission, I'll continue with this. Okay, I'm going to just start with a video. And
on February 20th, 2021, United Airlines Flight 328's Pratt & Whitney PW400 engine broke apart midair, with debris falling on residential neighborhoods in Colorado. Thankfully, shortly after the incident, the plane landed safely in Denver, and all passengers were alive and safe. There is no doubt that for those on board, this must have been an absolutely terrifying incident. I could only imagine what it would be like hearing the engine break up and seeing the flames outside of the plane's window. And to be sure, coming on the heels of the relatively recent fatal crashes in 2019 and 2020 of the Boeing 737 MAX in Indonesia and Ethiopia, flyers might be asking themselves just how safe it is to fly these days. Maybe, especially for domestic travel, it just makes more sense to drive. Welcome to Data Demystified.
so maybe you might be wondering, why am I giving you flight details and risk related to the flight? But it's all about training, right? So from what we heard from him, it appears maybe it's better to go by road than by flight. But what we see here is just the opposite, right? The flight is much safer than driving by road. Why is that? We can jump out, we are on land, we can jump out of the car. In spite of that, flying so many miles above you is safer. It all comes down to training, right? So when we train for driving or in a pilot thing, we don't just give a manual to students and say, okay, today the lecturer and the students will sit together, we'll all read this manual, and then whatever comes up, big or small, high up in the air, we will work out through this knowledge that we have. That is now not how training is done, right? We need to learn in different conditions. We have to learn how to drive in the dark, after hours, when the sun strikes us, in the rain, in the sun. All of those conditions you have to train before you pass out. Pass. So that is what training is. Training is all about doing things. It is making your eyes, ears, hands do the thing without thinking about it. When a patient is in front of you, you should not be thinking. That's not the time to think. That is the time to perform. So keeping that in mind, we have developed the OSME, which is training the students right from the beginning to work and to be able to perform as soon as they graduate. What does all of this require? So to me, competency-based education is more like potentizing your education methods. Because what we do here is every step of the time that we are training them, we give them feedback, they learn, they perform, and this keeps happening over and over again. So that's how we do this. Yesterday, I'll just give you an example. In this slide, the first column is all we do in the in how I learned Materia Medica during my college days, right? It's all drug picture based. What we need to do is we swap it, we make it totally ulta, and say we start with the patient, what the patient needs, and then learn the drugs. So we move from knowledge base to real world cases that we will be solving during your start from year 1, and then we move on. So just with the objectives, the first and foremost thing that we need to do, and this is how I learned it as well. When I was in year 1, I treated my pet dog, my cat, and then that's how it gave me spectacular amount of confidence. If I'm not doing those little prescriptions, if you don't taste success early on, it's possible that you may not want to be with it, engaged with it for the rest of your lives. So we need to taste success very early on. And that's the kind of success we try to give with this. So homeopathy, for every case, it's the first slide. There are 1,000 and more drugs. And how do I remember everything? I'll just give you an example. Now, every time you have to introduce yourself, I want you to use a different name for yourself. How long can you do it? That is a lot of cognitive load. For something so simple as to identify yourself, you should not be thinking too much, right? If you're made to do it, over a period of time, you're going to have some pet names. You will develop some pet Materia Medica drugs. You will overutilize few. You will underutilize a lot of them. So Materia Medica is not optimally used in our practice. So from the first slide, we take you to the next slide, and that's what competency-based is. So from year 1, we aim for something, and I'm going to talk to you about what exactly we do with that. So year 1, and okay, we will first talk about, are there any drugs in our homeopathic Materia Medica for pain relief? I want you to all respond to me. Are there any pain relief drugs in homeopathy? Yeah. Are there anything mentioned about absorption of clots? Yes. Are there anything that will dissolve extra growth? Yeah. If you look at all of those, there are things. Then why are we not training our students in pain management, PAL care, or geriatrics? Or we have had last 2-3 days spectacular amount of specialty medicine, and they have done it on their own. I'll give you one more example what happens. When you read a textbook like Pathology Kumar's, for every time there is new science being developed, which is publications and everything, for that to enter a textbook, it takes 3 years. And we get stuck with the textbook, which we have done 10 years back. So we are not updated with anything new. Everything in the last 3 days that you have read, which you have seen, whether it is nephrology, whether it is cancer, whether any of that, none of this filter through to your training in your colleges. And that's a very sad state. All we do in Materia Medica is get the drug pictures. None of us are being trained in any of this. Why are we not having a certain training method which says this is what you need to do in stroke, and this is how you prevent stroke, and this is how you need to do post-stroke? I'm not talking about protocols. I'm talking of a certain template, which we need, clinical guideline templates. These need to be already in part of our Mater Medica education. And if all our medicines, if all our conditions in this world could be solved with constitutional medicines, we didn't have to do anything more. But that is not how real world works. Real world works has much more complexity, much more comorbidities today, which we need to address. And those are the things that we make part of this OSME. So in the first year, all our first 2 years, year 1 and year 2, the aim is to build confidence in the students. And how do we do it? We have about 116 first aid type of cases. They're very simple first aid type of cases. I know in first aid we don't use medicine, but that's why I'm using the term first aid type of simple cases where there are 16 systems in our body and we bring them with that. For example, yesterday in the workshop we had bee sting. Okay, what do you do when you have bee sting? What medicines do you give? Do you stop there? Or do you say, do you monitor for anaphylaxis and then say what remedy should you be taking if there's anaphylaxis? So those are the kind of detailed things that we train the students. So the next we in year 2 and year 3 we train them in subclinical conditions where there is no constitutional problems, but let's say you have a person coming from corporate IT who is now saying, well, I think just did an annual checkup and they found out I'm diabetic, or I have hypertension. Constitutional medicines, so some clinical conditions. So we train them in these. We train them in all of these conditions. So one note I want to say, this is not just for students what we're talking today, it's not just for faculty. What I want is from practitioners here who have in your own specialties that you have presented yesterday and day before. We need your cases to be able to include them as clinical scenarios. And please contact me because we need to have a database of cases that we need to train the students in. So we also train them from real life problems which come up with Materia Medica. So year 3 and year 4 is all about making them ready for practice. What all do you come up with? Now, there are things like vitamin C, homeopathic, there are side effects in homeopathy. Now, this is a statement can be construed as a claim. Now, as a doctor, I should not be using this language. I should be using scientific language. So we include the scientific language, we plug into the broader pharmacological concepts, and then train the students. We provide the fixed scripts to talk about these things. So we need to use the WHO patient safety curriculum, and the pharmacovigilance, those kind of terminology include in our statement to justify why why homeopathy is safe. Now that is what we do. We talk about, and this is the kind of training we give the students in. Now you may also hear, and this is what we did yesterday in the workshop. So there are people who may say, homeopathy doesn't have any negative effects. There are no side effects. Sometimes, if at all there is a problem, it may, when I give a medicine, it may not work. Now, what is this kind of, what effect is this? Most people would say this is placebo effect or placebo effect. This is actually the null effect. What is a null effect? So, a substance that doesn't show any kind of efficacy. Now, is this really good for homeopathy? Or for other people to perceive this as homeopathy? No. I'll give you an example what happened in Australia. The research body called NHMRC, they did a review, and some of you may even know about it. They did a review and said homeopathy at best is placebo, or it doesn't act at all. So there is a general practice network, which is an authority which sends out guidelines to all general practitioners from Australia. They sent out an email saying, "We don't want to recommend homeopathy to your patients because it has no effect." So these are the things, terminologies that we need to be understanding. We need to plug into pharmacology and train our students to improve their language. And again, how is a mother tincture different from herbalism? So those are things that we need to know. Are there adverse reactions in homeopathy? So those are some of the things that we train students in. Now, here's a scenario. A homeopathic doctor recently has a success. And these are the kind of scenarios we give students in the classrooms, in these stations. So there is you have treated a case very successfully, which was treated by allopathy with no success. You have treated with success. The allopathic doctor says this is placebo effect. How are you going to counter? So those are some of the things that we help with. We also help with things like media, saying wrong things about. Sometimes we answers to it in kind of enthusiasm. We go and tell the media, okay, we did this and that, and then they will come up and say, this is actually, and how do you present your evidence? So we provide media templates for students to work with. We give them different strategies of how to talk evidence to general public. Why we have great number of medicines? Why are we not plugging into the national rural health? I mean, I'm not saying why are we not. Maybe there are some people who are doing it, but this is not trained for our students. You're not trained in maternal, you're not trained in child health, which has a lot of mortality even today in India. You're not trained in nutrition deficiencies that a majority of the Indian women have. So why are we not training specifically material medical students in dealing with these problems? So how do we do it? So what you see the beds, that is the kind of stations we have. Okay, we have about 10 for undergraduates, we have about 15 for postgraduates. So they go through each station, and each station has a different scenario, and then they have differences. So remember what we said? Well, yesterday, I'll give you an example of what happened yesterday. Yesterday in the workshop, there were about 25 people. And we told them very quickly, when you come up on the dais and start taking the case, make sure you read this. You follow the script, which was introduce yourself, consent from the patient, talk about confidentiality, and sanitize. And then explain the procedure, what you're going to do. 5 days. So very quickly they did that. Second person forgot the whole 25 people said, you did not do these things. So it is that quickly competency based education works very, very quickly and very rapidly achieves more than 90% results. So again, as I said before, there are levels to it. So we gradually go from simple to more complex cases. So the idea for undergraduate first 2 years is to build confidence. The idea for undergraduates second 2 years is to make them ready for their practice. Postgraduate is where start making a difference and contribute to the science itself. So this is where we are building leaders. So this is we start with UG basic. They will be looking at fast recall kind of medicines. They'll use material medical like Allen's Keynote, Nash, Fonter, those kinds of things. They same kind of acutes. They will graduate to third and fourth year, and they will be looking at comparative drugs. They will work with Pert's physiological, Parrington, Crown, and the postgraduates, same acute things, but they will be looking at more ICU types and much more intense, very time and resource based kind of training that we will provide. And this is the stations for the PG levels. The first week I showed you previously. Second is advanced specialty chronic care. Now we have seen quite a lot of in the last 2-3 days specialty medicine with. Now people ask, this isn't this deductive? Now there is a difference between deductive and examining the part as a whole. Okay, it is like a forest. When you examine, when you want to study a forest, you will explore the floor, you will explore the trunk, you will explore the canopy, because they all have different environments. So that does not make it deductive. That makes it examining a part as a whole. So we train them in that, and then there is on drug probings, HPTs. And then we also have about terminal care, pain management, complex care needs, rural health, and also here, because they have taken up leadership, we are training them to be in leadership roles. They will also be learning how to do policy writing, how to write. Undergraduates will learn how to write clinical notes, which can be given to the interprofession, all the advanced or the specialists. You need to be trained in. We train them. And then you also have research scholarship capacity building. All of this cross-disciplinary one agenda which yesterday was presented, whether it's agro or veterinary, homeopathy has medicines. It's not about me taking what I want for my practice. There must be some people who will make sure that the materia medica is optimally used and that we can use it for all kinds of things that it gives us opportunity for. This is when we ask me, when we develop the training, it is not for what we can already do with constitutions or what we can already do. It is to take it to the next level where the lowermost denominator of a student will raise their standard to a higher degree where we are able to do all of these. So there is training, okay, where we will be given feedback and then they will learn for feedback, learn, perform constantly. So the moment, if there was no mirror for us as a feedback loop, we would not look like this. Right? We need to look at ourselves in the mirror, which is a feedback. There is another feedback which will come to you about other people saying how good you look or why are you looking so tired kind of thing. All that is feedback. So without feedback, a human does not become better. So this is where a feedback-based, competency-based learning we are trying to do. So it has, this OSPI is developed, of course, by global standards. We have used OSPI, which is for pharmacology. We have used CANES, which is Canadian education for medical education. We've also used normal OSPIs. So I won't go into details about how it is done, the logistics. There are about 10 stations, 4 students in each And each station will have codes, whatever is required. If the case is neurology, then you will have an EHAM, you will have a torch, you will have all of that. So each station will have the tools, whatever is required, and the students perform. We give feedback, then the other student does and keeps doing. So every student has to. It's not like when they come in a group, one of them do and the others observe. There is no observation here. Every student has to perform. Okay, so we obviously there's a lot of reading materials we provide to the students before coming to the class, and these are all highly referenced, coming from international standards using WHO patient safety curriculum. So all of this has been used to develop these resources, which will be given to the student. All of these are already, we have already completed developing these things. We also have faculty training, without which we can't do the, because a lot of times, even when I went to, when I started in Australia, I wasn't exposed to OSCE, so I had to learn. So there is nothing wrong in saying I don't know enough. The faculty can say they don't know enough and then learn from there and then students. So I won't go into too much of implementation because that's the backstory. More important for the faculty, not so much for the students or practitioners. Where to from here? So we have already developed some of the resources, but what I really need is practitioners and specialty practitioners, especially to contact us because we want to develop case scenarios for the students. And we don't want to use AI or ChatGPT because the complexity is not enough of the follow-ups or daily things. So what we need is real life case scenarios that the students can use. We need to compile all that together. That is where we are at. Training module is partially done, but needs to be completed. The publication of OSBI is under review at the moment. So your feedback is very important, and development of case scenarios. That's where we are at. So one thing I wanted all of us to remember is materia medica is not to be taken as something that I use for my needs. Materia medica has a lot that it can do for humanity. We need to be finding solutions for humanity. And it's all there in materia medica. I don't think there is any condition that we can say you don't need it. If we are saying I don't want to treat you, it's only because of my limitations. And so that is what we need to be. We need to be expanding materia medica for its optimum use for humanity. And we have taken a very long time to optimize materia medica in a clinical terms. Give the students that chance to do it. So it's not going to happen if you have to wait for another 10 years after graduation to start developing a specialty. We need to be training students right from to be able to think like this and have confidence in materia medica. So what I want from you all is if you are a clinician and have case records, please contact me because we will use this. This is OSPI is a link between practitioners and these students. So that's what we need from you all. Please join the transformation. One of the things that I would require is also the NCH, which does the curriculum to take these models seriously to be able to have standard across all colleges in the country to bring standards and have the kind of standards which Arabic students have, or maybe even better. So thank you all for listening. And maybe the only presenter who's done it before.
Thank you, ma'am, for that illuminating session, clearly demonstrating how counseling can strengthen competency, confidence in practice, fitness, and empathic education. May I now invite Dr. Deepa Pais, Associate Professor, Department of Pathology and Microbiology, and Deputy Medical Superintendent, the Muller Homeopathic Medical College and Hospital, to present the certificate as a token of our gratitude to our esteemed speaker, Dr. Asha Kiran. Thank you, ma'am. May I now request the chairperson to introduce our next speaker.
Dr. P. Manohar Upadhyay is a Bachelor of Veterinary Science, Integrated Veterinary Practitioner, Rural Foreigner, Rural Veterinary Service Center. Dr. P. Manohar Upadhyay is a pioneer integrated veterinary practitioner over 3 decades of experience in the treatment and holistic management of animals. He is a graduate from Veterinary College, Bangalore in 1987. He has devoted his career to binding modern veterinary science with traditional healing system to provide comprehensive care for livestock, pets, and animal species. Today, Dr. Manohar Upadhyay is speaking on the topic handling slavery and chemical intoxication with veterinary repair, where he will share his clinical experience and evidence-based insights into managing acute toxicological emergencies in animals through homeopathy, emphasizing resonance between traditional wisdom and modern veterinary science. Welcome, sir.
Namaste, everyone. And whole Parliament's team has given me the opportunity to be here. Today, I am going to present milk bucket and intoxication cases where we widely use homeopathy medicines. Otherwise, there will be a lot of complications if we are very stick to conventional therapy. Of course, we do holistic approach in almost all cases. If we handle nearly 60 to 100 cases a day, all cases we apply homeopathy medicines. If it is required as a link, as a treatment therapy, or it has a routine practice. Further, quick recovery, fast recovery, and smooth recovery. This again, welcome you all for the questions. And definitions of homeopathy in veterinary practice, it is not to say in life, it is for wellness. So that is other duration and of course you have to concentrate production and reproduction, especially in farming. First, I will discuss about intoxication cases. In the veterinary, there are two types of intoxication. One is ingestion and inhalation. It's almost every day we do get, especially in small animals, dogs and cats, and some birds also. See, if the neighboring house is very second what is going on. If we have dogs or cats in our house, they get investigated. It is only by inhalation because it contains lot of fungicide. So either they don't mention what the fungicide inside, or it may have lead also. And continuous inhalation of these fungicide, kidney and most of the organs gets affected. In garden pesticide, weedicide, pesticide. See, even after 15 days with heavy rainfall, residues of the pesticides are retained on the grass or on the plant. If dogs and cats have a tendency to eat grass, even after 15 days of heavy rain, the residues of the plants are enough to cause toxicity and death. And of course, most of houses are using mosquito repellent, corn, liquid, or intention, grapes, and mortal, even DDT is bad. Still, people sell it in a different name. So in the name, they sell so many plants. And Garbati, it's a major culprit for routine toxicity. Because they usually in preparing agarbatti, they dip sticks almost 4 to 5 types of toxic chemicals. When the room freshener, air freshener, scent perfume in see indoor cats, and they cannot go or to inside the house. People keep litter material inside the house. If it is that is scented, it is a chemical. If it is inhaled, then it is a very, very high toxic chemicals. Why I am selected this subject is all these chemicals are carcinogenic to human beings. We need not to express our technology. After 20, 30 years, we may get carcinogenic problems. But at least immunity will come down, which is very much harmful. So we may succumb to so many other problems, especially children below 5 years of age. Their metabolic basal metabolic rate is very high, BMR. So for them it is very very toxic exposure of these chemicals. As animal size is small, cats, birds, they are very much sensitive to these chemicals. So through nose, this gas or vapor, whatever it is residues, inhaled reaches blood, then it damages liver and kidney and other vital organs. And injection poison. People intentionally kill some animals. For some people, it has become a habit to take poison, even in the tasty food. If accidentally, uh, uh, if it is eaten, it is this poisons. And of course, all painkillers, even many painkillers like ibuprofen, meloxicam, they are also highly toxic. And the damage is not only intestine or this one, even it depresses the bone. So everything becomes is affected. Even now, is 1/4 of paracetamol tablet can kill a cat. Pesticides, rodenticides, weedicides, these are when in the ingested, it's a clear toxicity symptoms we do come across every day. See, it is a clear cut inhalation toxicity in a cat. Within a day, cat has recovered just because of the homeopathy medicine. You can see the blood mixed stool in the litter. It's just because of continuous use of scent or perfume inside the house. So So there will be bleeding. The clotting mechanism is affected. Mucosa of the intestine is get damaged. So next day, this is not in my clinic. I recommended visit to the doctor who is practicing. So next day, just to thank the doctor, came with the can and there's a organ medicine bottle on the table. So can was not my next day. So possible was given. So was one of the medicines that they mentioned here. Depending on the signs or symptoms, we recommend the medicine. So one day camp is not needed because of the medium medicine. It's an acute kidney AKD, acute kidney disease and hepatitis because of inhalation toxicity. Uh, so blood picture was taken. Of course, we do treat with the foods because when the dogs are not eating, we have to give them vitamins. Stream of treatment is homeopathy because it's a non-infectious. It's a case with a lot of damage to liver and kidney. You can see the creatinine and SGPT and alkaline phosphate level. That is see first slide. Weight of blue, creatinine level is 5.7 in alkaline phosphatase was then by 15 days. See the alkaline phosphatase coming down significantly and creatinine is almost normal. When we have used only mainly homeopathy medicine and if not eating fruits and vitamins. Most of the times antibiotics and other medicines are not at all required unless there is a very severe infection. Associated infection. See, this is a non-infectious, clear-cut inhalation toxicity case. Say another acute kidney case, a 4-year-old dog with not eating and vomiting, both liver and kidney damage. See the blood picture before and after. Here creatinine level, then alkaline phosphatase, GPT, after a month, blood picture almost normal. Say another case of poisoning. Vomiting with blood, temperature is there, recumbency. See, very unique kind of case. We have used only one medicine, homeopathy, plus 200, of course. It prevents secondary infection or if there's infection, we use amoxicillin. We will not continue the use prevent secondary infections or high degree of infection. Antibiotics necessary. So fingers lactate, fluids, and vitamins. Because fluid is always holistic to save the life. So same, see the dog response before treatment and blood picture, the COT, SGPT, and creatinine almost okay, COT and SGPT. So next day 2, the treatment and see the response. Plutonium and cardus on the day 2 because there was a very severe liver damage. And day 3, we have the Jerusalem Naja and Without homeopathy, these cases mix together, works together for recovery. With lot of medicines. So in the another case, rodenticide, this is a very clear history is there. Dog has eaten rodenticide. You know, almost lifeless, just any response is there, people response is there. Just treated in Cosmos 200C with almost only flight trips, no repetition for that. And in another 3 days, 3 times a day, and other medicines are reverse lactate and vitamin K. That's all. Otherwise, it would have ended up with the severe renal or hepatic damage. Definitely would have severe jaundice and something. So here, no antibiotics, no other form, only phosphorus was used. It's a very beautiful case from the documents. See the very second. We may not give any other medicine for the symptom. Once the start taking for this, our role is over. Another acute kidney case, again it's a exposure to inhalation of the termite repellent. See, only supportive therapies, IV fluids and vitamin. It's a 1 week treatment. See the blood picture. ALT 170, creatinine 11. This 16th August. Next, creatinine has come down to 2 only by 5 days. So next to follow. ALP is high, then it has come to November almost normal, both liver and kidney were normal. So till then we continued homeopathy medicine, whatever the required medicines. It's a nasal toxicity. Somebody has given meloxicam, it is not even. So it is some people recommend, but they because of the old dosage or sensitivity of the patient. See here the can you see the pathology? There is a corneal edema with the fluorescent blindness and corneal acid just because of one dose of painkiller. Just maintain with the homeopathy medicine and some fluid subcutaneously, and then no antibiotic, no other things. Peace smell, causticum. Able to see this is a beautiful recovery just because of the homeopathy. Say another chemical intoxication, jaundice with dullness. See the blood picture, alkaline phosphatase 200 plus, and creatinine 2. 20th is just by 1 week, alkaline phosphatase is almost normal and creatinine. So maintain only with the homeopathy. And if they are active alert, we can just manage with oral glucose powder if they are not eating. Only if there is severe dehydration, then we have to go for IV fluid or subcutaneous fluid. So now I am shifting to snake bite intermination. Say viper bite. It was a miracle even for me because this skin is like intoxication case. It's a viper bite with blood in stools. See, viper, what is the pathology? It's a bleeding disorder. So there was a bleeding in the stools in the dog when it's presented. By just 50 minutes, a dog is able to run around in the clinic. We just managed one dose of antivenom and vitamin K, fluids, and homeopathy. It's a miracle. Even for totally, we enjoy this case. Medicine is given lachesis, echinacea, hospice, 30 with off the 10 minutes gap, initial 4-5 doses, then say one for another 2 doses. Only one day, follow up next day, no further vitamins, nothing, tonics, nothing. See, this is a story, almost highly intoxicated, snoring, semi-conscious, not able to get up. See, the breathing stomach, the something critical is attached to pain also. It is just by 50 minutes in this. 50 minutes, only 50 minutes, within 50 minutes, can you imagine? In clear of toxic fake, even it's a miracle for us. So even today, it is a miracle for us. See, it's a cobra bite. Dog was snoring, almost unconscious. See, before allopathy medicine, injection, fluid, only as a first dose, see the Naja. See the response after putting one dose of Naja. Now, people who the homeopathy is a placebo or not working, for them, we see this See, it is just seeing here and there what is happening. So, unconscious to semi-conscious. Next, within 5-10 minutes, I started putting echinacea. So, alternatively, Naja and echinacea, only these two are more than enough for self-side. Because the society should not blame us. Now, doctors can and everything. Activity. Whatever the degree of toxicity, we just manage those active homeopathy fluids. That's all. No other medicine is required. See the response after the one dose of echinacea. Because right now, when we don't know spent echinacea started seeing here and there versus here by that. Is recording. There was a reaction to antivenom. So I gave one dose of dexamethasone. It's a ultra short acting steroid. Otherwise, I would have died. The beauty is all steroids are not harmful. Dexamethasone we can allow let's say compatible medicines with the homeopathy won't affect each other. Homeopathy we can use when there is no dose of dexamethasone is required. So dexamethasone has strong reaction. Then again started putting the pills of Naja and echinacea. Still, not hangover is over. So I handed over the home medicine to put it. We cannot give more number of antibiotics show reactions. So now getting conscious in many cases of homeopathy. So first day one. See the next day without any follow. No follow. Same cobra bite with the toxemia. Started eating. We didn't give further any tonics and all. So homeopathy has saved the life. So this much of confidence in every case of it's a simplified something almost after reaching us. It was a few minutes of bite. Almost a hopeless case because there's a gasping, no conscious. See, mouth respiration, mouth respiration. About to die. Even if there is a delay of 5-10 minutes, it's about to die. So we started putting nausea and echinacea and 1 dose of antivenom. See the next day without any follow-up. Next day no follow-up. No fluids, no vitamins, no tonics, nothing. It's a high degree of toxemia of cobra. So this is the beauty of homeopathy we do come across every day. When I presented this intoxication, inhalation and injection intoxication cases and snake bite, two things. Whenever you in this classical homeopathy come across pediatric cases, I request all of you make history about chemical used in the house. Or if anyone come with a repeated problem of the same pathology, go to intoxication, whatever they everything, because that please have got lung cancer just because of that. If this history is not taken, then treatment regimen almost will be a different thing. So especially pediatric practice, it's very important to rule out inhalation toxicity of the chemicals. And in snake bite, if there's a holistic approach, even in modern medicine, almost we can say almost. See, when there is a news in the paper that farmer is died of snake bite and that, if there is a opportunity to use homeopathy medicine simultaneously in the hospital or when he is out of hospital, definitely we can save number of lives. That is my ambition. It should holistic approach should come to practice. So these are the observations before entering. And no homeopathy will work when there is a severe immunosuppressive drugs, or if there were wave of immunosuppressive drugs, we don't have to use homeopathy. There is our observation. Once few doses of dexamethasone is okay, it won't affect the action of homeopathy. See, during blood transfusion, severe dyspnea, to use dexamethasone, wherein homeopathy will not get affected. And this is a continuous process. We have to learn continuously and we have to respect the universe for better knowledge and better care of the society. And this is the continuous process. This happiness will be there uh, during our routine practice. See, owner is happy, crew is happy, vet is happy. Practice also. Owner, doctor, patient, everybody is happy because of the homeopathy approach. So soaring spirit till we cannot lose because of the homeopathy. And thank you, Mangaluru, for the patient here.
Thank you, sir, for the highly informative session shedding light on the practical and life-saving role of homeopathy in managing snake bites and clinical intoxication in veterinary practice. May I now invite Dr. Savina Fernandez, Professor, Department of Materia Medica, Father Muller Homeopathic Medical College, to present the certificate as a token of our gratitude to our esteemed speaker, Dr. Mangaluru Upadhyay. May I now request the chairperson to kindly introduce our next speaker.
Dr. Disha Rao, BHMS completed from my college, Government Homeopathy Medical College. MD completed from Father Muller in the Department of Pediatrics. Disha Rao is a dynamic homeopathy physician and research specializing in homeopathic neurodevelopment disorders with over 7 years of clinical experience. She has dedicated her practice to improve the health and quality of the life of the children with autism spectrum disorders, ADHD, cerebral palsy, and learning disabilities. She currently leads the clinical research and Mitra for Life, not for profit organization provided integrated and individualized care to over 2,000 children across rural and urban Bangalore. She will focus on exploring the clinical potential of homeopathy in development medicines through an evidence-based and multidispensary approach. Today, her topic is bridging gaps with homeopathy, community central integrated model for neurodevelopment disorders in rural areas. I welcome you.
Thank you, sir. Good morning. I hope you're all not saturated and too hungry. I'll keep it short. I'm covering the topic today. Bridging gaps with neurodevelopment. This is a study that's a community centered treatment model for non-developmental disorders in rural areas. Foundation, Mitra from Life. That's the context of where the data comes from. I'll introduce Mitra for Life Foundation. We're a non-profit organization working for treatment and support of children with neurodevelopmental disabilities, that is autism spectrum, ADHD, GDD, and others. This foundation is started by Dr. Mangaluru, a specialist in autism and child development. Aiming to build a community-led system of holistic healthcare, therapy, and inclusion for children and families with disabilities. Our main integrated homeopathic center is in JP Nagar, Bangalore, and we have peripheral clinics by collaborating with the disability sector of the government, the block resource centers with different clinics in every district. We have 4 rural clinics running through collaboration with the government and 5 clinics in partnership with other NGOs and body intervention centers and special schools. We're also grateful to be supported by some organizations and corporates for our work. We currently have more than 2,500 children under treatment with neurodevelopmental disabilities in rural Bangalore. And we're delivering homeopathy as well as supportive therapies for treatment. The community-based healthcare and rehabilitation is our main pillar of the treatment. And we also have the rural that has been added on recently, which is the first vehicle fit with physiotherapy occupational therapy equipment that are designed to reach remote rural areas from where children cannot reach centers or even government offices. The background of the study, neurodevelopmental disorders are the major concern today because the prevalence is rising every day. In India, we have good awareness and education. Neurodevelopmental disorders are raising and causing a lifelong challenge for the children and their families. Many schemes and facilities are provided by the government, but still there are many lacunae that has to be filled. The latest statistics show 1 in 8 children in India have at least one neurodevelopmental disorder. That's an astonishing 12% of the pediatric population. Medical statistics show that out of neurodevelopmental cases, 1% is autism and 7% ADHD. Some of the complex schemes by the government providing support to these children are the scholarship schemes, the grants, since we disability. Even with these, rural pediatric children are still suffering. This is why it's showing the NGO. The research question here is, can homeopathy integrate with supportive therapies
bridge the developmental gaps and lessen the burden of disability in children with developmental disabilities. This graph is only a representation and not derived from data. What I'm trying to say here is the developmental gap in a small child may be a 2 to 3 year old diagnosed with within only goes on progressing when the child reaches the age of 10 or 15. It has almost permanent disability. Even if it is speech delay, child age 2 or 3 this still has potential to develop speech. But if left untreated or untreated, the child may progress to a non-verbal child. So my aim is to evaluate the efficacy of homeopathy integrated with therapies in the management of neurodevelopmental disorders in children in rural and areas. Apart from homeopathy, we also use supportive therapies, mainly being physiotherapy, occupational therapy, speech therapy, and psychotherapy in council. We are using standardized qualitative and quantitative tools that feedback as well as assess the progress of each child. We also aim at examining the role of community-based resources in identifying and supporting children with neurodevelopmental disorders. This is to provide sustainable and long care for these children. All these cases are taken from 3 centers of Ultrafilament, that is the Blood Resource Center, Kanf, Mangaluru, and an early intervention center, Vanchandri. So retrospective study involving 100 children in the age group of 2 to 10 years who belong to low socioeconomic strata, diagnosed with 3 diseases: global homoeopathy, autism spectrum disorder, and ADHD. Children with lack of follow-up and cases with mixed or multiple diagnoses have been excluded from the study. Individualized homeopathic remedies have been used, selected through the layered approach by George Vittorikis. Treatments there is occupational therapy, physiotherapy, speech therapy, and counseling and work. The outcome has been measured using quantitative tools, that is, the scale areas for the global developmental unit, the ICO experience with assessment of autism for autism, and ADHD rating scale hand washing. And we've also formulated pre and assessment tool to define summarize the outcomes and conclude on this. Because Gaussian software has the NGO software for documentation and used standard case analysis and documentation formats. The performance from the secretary is used. And statistic analysis has been done using the paired test. So out of the 100 cases that we've seen, we see 51 cases of autism spectrum, 21 global development delay, and 28 cases with ADHD. But the majority of males indicates that the age group is between 2 to 10 years. All the low or the up to low socioeconomic category. Most of the parents being primary school graduates. So in autism spectrum disorder itself, we've seen a total of 51 cases. Here the ISA, that's the Indian scale for assessment of autism tool, has been applied. So if you see the question, they proceed with motor, social, behavior, and speech, these kind of domains. And the total score for this present average to compare the 3 and 6 of the children. So a pre-average of 153 has reduced to a 1.5 storage. And the current is very shows a significant value for the range of confidence in women. Using the same scale, experts can classify cases into a minor, moderate, and severe degree of autism. So, like the scores, below 70 shows no autism, between 70 to 106 means minor autism, and 107 to 153 is moderate autism, 153 is severe autism. So comparing these 51 cases, 24 with severe autism, like you see in the table. 4% of them have reduced to the mild autism category, and 46% of them have reduced to moderate autism category. In moderate autism, before treatment, there were 24 cases of moderate autism that were reduced from 80% to the mild autism category. still reduced to moderate also. Autism cases have been in mild category itself. So we've also clinically determined the kind of changes that has been brought in autism cases according to age. For example, in young children, like between 2 to 4, there's a lot of IQ, speech, cognitive, behavioral, as well as self-independent skills. As progresses, probably the potential for the development reduces and behavioral aspect improves until the age of 12 to 13. So, as we also published another study last year, thinking about the age-wise and domain-wise changes. Global developmental delay, according to the DSM category classification, is children under the age of 5 years can be diagnosed with global developmental delay. 21% of this has been taken under the study. And the developmental portion is calculated using the Denver's developmental tool. Formula for this is developmental age to chronological age into okay. An average of 31%, that's the developmental quotient, has risen up to 54% post treatment in global developmental delay. In cases of ADHD, is a standard point because process and between the administration in a rural setting, which shows that's the version of the ADHD rating scale, which is also standardized. Most of these cases were a mixed ADHD, that is the inattentive as well as hyperactive training. The ADHD score percentile that has been 99 pre-treatment has reduced to 92 post-treatment, and it shows significant p-value. We have theoretically about this. Consider George Metallic's layered method. The first layer of the hyperactiveness or the inattentiveness in ADHD has to be targeted first. That was what was done in these cases, which will also lead to developmental outcomes as well as people having learning disabilities and like I said, we used another tool, that's the pre and post assessment tool that we found by deriving different points from different scales, like the ISO points, firstly independent scale, and the expansion. So none of the standardized tools that are already existing can cover all the neurodevelopmental disorders as an overview, as well as none of them give us a realistic perspective. General health and physical wellness play a major role in our treatment. The standardized tools do not consider these factors to show improvements. So we've also included questions like constipation, urination, appetite, and recurrent infections in this scale. We can broadly classify this into the general health, development, and behavioral domains using the scale. Well, it's just according to the graph, in as an input to all 100 cases. Qualitatively, also, it's important to input from parents, especially the mothers who have to bring the children the entire day. So we've taken interviews and found focus groups among parents. Even in 68% parents reported satisfaction with the treatment. 59% expressed significant improvement in their children with the treatment. And 71% of the parents expressed satisfaction with the treatment method. And integrated homeopathic management showed positive developmental and behavioral outcomes in children with neurodevelopmental disorders, especially considering the rural setting where there's limited access to care. There are almost no special schools and therapy centers in the rural areas. And almost unaware of the diagnosis of the condition the child has. So considering this, I think including homeopathy as a very feasible method of treatment has made a lot of difference in these children. It also highlights the potential for scalable community-based early intervention models, including homeopathy with government programs. We yet to tap into the health sector or the health sector in primary medicine. to which we can also young children and very, very early intervention, which can even give better results. We right now working with the education department and the BRCs. Access to Anganwadis for their studies in early age, I think the significance the way to and play in these children will be better. We're also working on scalable models integrating homeopathy within the research frameworks and needs apart from established institutions and organizations for this. I think capacity building and training of the local resources like the mothers or the parents and families can also help explore the therapies or information for other parents who are not able to access therapies early. The key things I want to highlight here is there's very established evidence for speech therapy, occupational therapy, and it is the main mode of treatment that people are going to for neurodevelopmental disorders. When it comes to homeopathy, there's very much lack of research and lack of evidence-based papers that have been published. So if you can do this, I think you can see the bigger projects and do much better for the society and with respect to disability. Collaboration with educational institutions and health department will be a key milestone in this. It also show glimpses of our rural camps that we can in Kalampura and Ayapur. I'm also happy to announce that we're opening the Fund Life Foundation is opening a new center at Kankanady in collaboration with the government. It's going to be a first of its kind intervention center in a rural area. I'm really grateful to Father Muller's Homeopathic Medical College for giving me this opportunity and Dr. Prabhu Kiran sir for inviting me here. I'm really grateful to be back on the stage where I graduated my MD from. I'm grateful to all the parents and families who believed in us and followed up regularly, to the bureaucracy centers who have been very cooperative, all the special schools and partner NGOs. Data analysis and statistical results for this research is done by Sachin, who's my husband. I'm grateful to Mitra for Life and the founder and co-author Dr. Madhuri Vaideshwar for the opportunities that have been given to me to create an impact. Thank you. Thank you, ma'am, for this insightful session highlighting the importance of homeopathy and innovative. May I now invite Dr. Mini Ivy, Professor, Department of Materia Medica, Padamala Homeopathic Medical College, to present the certificate as a token of our gratitude to our esteemed speaker, Dr. Disha Ramke. Thank you, ma'am. Dear delegates, kindly know the prize distribution for various competitions held will take place after the main session. We kindly request all the delegates to be present. May I now request the chairperson to kindly introduce our next speaker.
It's my privilege to introduce next speaker, Professor Dr. S. Praveen Kumar sir. He is my teacher. He did his PhD from Sonajaro Silsagar Homeopathy Medical College, paid. And he at present is a professor in Mangaluru Homeopathy Medical College, Kankanady, Telangana. He is a chairperson and editor in National Journal of Homeopathy, Mumbai. Being a postgraduate and PhD scholar in homeopathy medicine, he served as the principal and head of the Department of Medicine at JSPS Government Homeopathy Medical College, Hyderabad, Telugu. Dr. Praveen sir, Kumar has played a potential role in advanced medical education and clinical practice in India and abroad. He has been a recipient of numerous prestigious awards, including Dr. APJ Abdul Kalam Lifetime Achievement Award in 2023, Telangana State Best Teacher Award in the year 2017, Dr. Mahendra Singh Memorial National Best Teacher Award in the year 2014, Dr. B.K. Bose Memorial Best Teacher Award in the year 2005. Today, he will be speaking on the topic homeopathy in antimicrobial resistance. Very did research in the Bangalore, where he will explore the potential of homeopathic therapeutics in addressing the global challenges of antimicrobial resistance through integrative clinical approaches, scientific validation, and public health citizens. Thank you, sir.
Good afternoon, dear friends. Of course, I struggled hard to bring as many audience as possible, but it was difficult because they were all demanding more money. My friends have accepted for half the money, and that's the reason why you would have seen them raising their thumbs. They said, "Yeah, we are here. Please pay the money." Okay. Anyway, I believe in one important principle in homeopathy. Homeopathy has been surviving on quality, not the quantity. So I tell myself, don't worry, even if the Nepalese mix doesn't matter. Let me will speak about homeopathy in antimicrobial resistance cases. Dr. Abdul Ghafoor should have come before me. His presentation was there but cancelled due to his own personal engagement. He is one such gentleman who is working relentlessly in Apollo Hospital, Chennai, on AMR. We called him to our first homeopathy Vigyan Sammelan in Hyderabad 2.5 years back. And you are aware that AMR is a big challenge for the whole medical fraternity, not only to allopaths because they have created, but also to us. It's not an easy task to treat a man-made disaster. Why is a man-made? Like Hannibal also narrated very clearly, these are all artificially created disorders, diseases. There is a disease and we spoil it with our own bombardment. And that leads to a damaged situation. Now, I'll show you two cases, just recent ones, just to show you. There is a 50-year-old gentleman with chronic prostatitis. They were not able to diagnose for first few months. Where is the problem? But then one urologist said you have to do colorectal examination, massage the prostate, extract the prostatic fluid, and then the culture sensitivity. Then he got the infection. That culture was positive. So Klebsiella was positive in prostatic fluid. And if you happen to see it is resistant to every antibiotic, every almost. They tried that one which is like cholesterol, intermediately sensitive, and could not yield any result. So they tried a lot, everything could not do. Now they have continued on 4th February, chronic prostatitis, continued with Klebsiella. This is another report. This is the time when he came to us. We gave the medicine. After the medicine, for 1.5 months, three drugs shifted their loyalty, like Nitish Kumar, changed to sensitivity list. Now these drugs have become sensitive. Now this man asked me a question sincerely. Should we take that antibiotic again? I said, no, no need. No need to take it. So this was the situation. This is a clear evidence that so I welcome all the dignitaries, including the father, Desh, Dr. Kim, Dr. Ishwar Das. Anyway, I'm thankful to them. I told them to come, so they came a little late anyway. Thank you. So now, with the help of homeopathic, I'm not into discussing what medicine I have given, but only to impress upon you that your medicine, if it is prescribed rightly, can alter the culture sensitivity report. It has been shown. The culture report which was showing resistant to all three important antibiotics have been shown in the list of sensitivity. So two important antibiotics also changed to sensitive list. I gave tuberculum 10M to start with, then like podium 0 by 1. These were the two drugs which I had used, and the sensitivity list has been changed. 4th October 2025. This is the latest one. We are not going to give those antibiotics to this gentleman, but only for our academic interest. We have the capacity to our remedies change the sensitivity to this. In fact, in my PhD, my thesis is on that. My thesis is on the effect of tuberculum 13 on the genetic sequence of multi-drug resistant tubercular organisms. And we have established beyond any reasonable doubt that with the help of tuberculum 13, we can change the genetic sequence of the organism. I'm not talking of human being. And I'm not talking that it would be a positive change, but it can be a change. So this is a similar one where Klebsiella pneumonia has responded to our drugs and changed its resistant status to sensitive status. We will have one more case here. 10-year-old girl, 1st August 2025. I told you recent ones. Umpteen number of cases are there in our archives. Umpteen, not one, two. We have been working on this AMR. E. coli positive recurrent UTI since 1.5 years. 10-year-old girl was admitted to hospital every time and IV drip antibiotic was given. This was the scenario. So here, if you see, you can see sensitive only 3 drugs. And amikacin, gentamicin, meropenem were given several times. Yet the girl did not improve. The organism was always equal. Then the sensitive list changed in just 1.5 months. The drugs given were carcinosin and Satya 0 by 1. So this is one more recent one. I selected only the recent reports to show you that it can be changed. It has been changed several times in many cases. So what is this AMR? We know very well if you really threaten any individual, any animal, it would bear for some time, there would be a repercussion or a reward. So what will happen? An organism also same. So bombarded with your powerful antibiotics, fight or flight. Either it has to fight with you in the form of before becoming resistant, or it would fly off, means being killed by you. Most of the times they fight. So what should we do now? Now, of course, it looks like I'm blowing my own trumpet about homeopathy, but it is a fact. This is the one which can, I already said, we can watch for it, we can alter the genetic sequence of these microorganisms, and we can alter the sensitivity report of all these microorganisms. So here, all these agents, they cause a lot of problem. And even in fact, British Medical Journal, it has been published that 75% of antibiotics use is a questionable point. And emergency vehicles, on the counter, you get a lot of drugs. Most of the drugs you may not require a prescription. And if there is another problem, if a person is being prescribed with an antibiotic for 5 days, the fellow goes to the counter and says, I will use for 2 days, and if it works, I will take another 3 days. If it doesn't work, I will not take. The another 3 days medicine will be waste for me, money is being wasted. This is the commonest experience. And in 2 days, he will respond positively and he will not take another 3 days medicine. Non-compliance of this dosage would also lead to resistance. So the microbes would turn resistant to the same antibiotic. Like in simpler terms, how they become resistant. Either it eject antibiotics from the bacteria or bacterial proteins, they destroy the antibiotic or they mutate in such a way it does not respond. Most of these microorganisms have the capacity to mutate. So, MDR-TB, we all know, multi-drug resistant tuberculosis. Now they have named one more variety, extremely drug resistant variety. Just a step above. Globally, 4 lakh new cases in 2023 itself, all over the world. 1,50,000 patients died with MDR in 23. This is global tuberculosis. And you have got drug resistant tuberculosis, multi drug resistant tuberculosis, and extremely drug resistant tuberculosis. So the step is increasing, making it difficult for us to treat them. TB resistance, it has been done, survey, Hyderabad, Kolkata, Chennai, Delhi. We have found that children, many of the children are affected. 9% of all pediatric tuberculosis patients are resistant to common drug which is evaluated is rifampicin. So this is all like drug resistant state. It is increasing by leaps and bounds. Primary drug resistant, secondary drug resistant. All these things are theory anyway, but the fact remains that we have the answer for it. Come to us. We have to propagate. We should tell, Dr. Mangaluru was telling, please tell everybody that homeopathy is given to snake bites or toxins or poisons. It should reach the people. And who should reach this? Dr. J should take it to others. Being the chairman of Global Homoeopathy Foundation, when he boasts himself that he heads an organization which is not for profit and it has the capacity to reach the nook and corner of country, we have to take up and take this message to everybody, all of us, whoever is here and your friends. We need to shoulder this responsibility and take this message to every person who is in need, who wants it, should tell them, we are there, we will do something better than what they expect. So, DOTS program is there, it's wonderful, it is controlling, but actually, a lot of problems. Even non-compliance is one of the major factors. So we need to step in. tackling the MDR crisis. Now it is the time. 1 in 4 people had access to MDR TV treatment. Only one. Means 1/4 of MDR TV patients are only being treated. What is happening to 3/4? Grab them, treat them. You can also earn because it will not be dangerous. So you know that Boni Arjun, he was consulted to homeopathy. So it can be our domain. When Boni Arjun was converted into homeopathy, there were several instances where homeopathic treatment was very effective in the treatment of tuberculosis. Insanity was treated in tubercular patients as well. Though of course we have an article where insanity saves the tuberculosis person from death. But both were treated together in homeopathy. If you see in the archives, we have tuberculin and bacillus. Dr. Ashley Rose yesterday was showing his provings on bacillus. Till now, most of us young doctors, I am not young anyway, but young doctors like you would see, read it in Allen's Keynote's tuberculinum, and in the brackets on the asterisks and their description. Bacillinum is similar to tuberculinum. But he has shown yesterday there are so many different varieties, different pictures. Things are there. But basically, we should understand that two drugs are there, two different drugs, different sources, and different features. We have that anyway. We have like this three-pronged attack or usage of homeopathy. Either combine with allopathy or give exclusively homeopathy, because even in pleural effusion, allopathic treatment takes longer time, homeopathy takes lesser time. And in all resistant cases, it should be used, though it is said as need. It is so softer word, it should be used. That's how you definitely can. And probably you would be knowing the second line of drugs in tuberculosis are highly dangerous, very powerful, so many side effects. One of my patients, she was a homeopathic doctor from Dharwad Homeopathic College, a Telugu girl. She came, she was on second line of drugs, and she was almost like a skeleton. So now she is practicing in Andhra. She's completely cured of her problem. She could not that vincristine or some drugs which were given. So if we have taken up one in vitro study with the help of one microbiologist from Hyderabad and in the Institute of Tuberculosis in Bangalore, and we have selected H37RV control strain, and there we have taken arsayon, drosirol, calcium. According to my little knowledge of homeopathic medicine, I selected these three drugs, each one in three different potencies. Those dilutions were given. Initially, slopes were made and did not yield a very good result. Only Pulstilla 6, there was growth. All rest of the Pulstilla 30, there was growth. All rest of the things, there was no growth. Then we have done suspension method. They have done it. And they found it that there was no good growth of organism in tuberculin. So that clearly indicates that tuberculin 30 is highly capable of inhibiting the growth of these multi-drug resistant tubercular strains. This is what we have done. So we started giving it in clinical trial, and we have seen it in 30 cases of MDR TB. And this was my thesis in MD. And in all 30 cases, except in 7 cases, 23 cases, there was tremendous improvement. In 17 cases, I had to use other homeopathic remedies along with tuberculum 30. 4 cases discontinued. Other drugs, phosphorus, arsenic, picalicar, pulstilla, carcinosin, arsenic. So, in any case of AMR, you can definitely vote for it. Homeopathy definitely works. It has the capacity to alter the sensitivity category of blood microorganisms. So in vitro studies are showing and clinical studies are showing. So you don't need to have a lack of courage. Right? I thank Dr. Prabhukiran, Father Muller, DHF, and all of my friends, Dr. Tiwari and Father, everybody, Dr. Prasanna, everybody who are here, first of all, and who are not there also, all of them. I thank you very much.
Thank you for the enlightening session, sir, offering fresh perspectives on the potentials of homeopathy in addressing the global challenge of antimicrobial resistance. May I now invite Dr. Indu, HOD, Department of Forensic Medicine and Toxicology for the Muller Homeopathic Medical College, to present the certificate as a token of our gratitude to our esteemed speaker, Dr. S. Praveen Kumar. As we move towards the close of the session, may I invite our moderator, Dr. Girish Navada, to share his insights and reflections on the session.
Good afternoon to one and all. And organize. Dear Dr. Chairperson of this mission. Indeed, it was a very wonderful session by all of the real scientists has come forward and given the valuable um, experiences with homeopathic medicines and different scientific aspects for the young brains to take over the further scientific researches. In this regard, the first session was Dr. Dinesh, MD, homeopathic as well as psychiatry, who has combined both the degrees very well and taken a session on emotion and its relation in selection of homeopathic medications. He also created a very insightful system we come to a different medications, especially for homeopathy, especially in psychiatric cases. Often we certain associated conditions that major causes. And it should be well with the aluminum tooth 211 fluorescence and 216 fluorescence container to a definite cause of emotional treatment. And also mentioned the humanitarian methods, which is initiated with, I think, with contribute Dr. Suman anyone for this particular experiments that he has done in this experimentations where he has identified the humanitarian method is the only method and he has given a classification system in homeopathy which is well established in his and the second session was by a dynamic person, Dr. Farham, a vibrant, living, and we can say very energetic, and made every reduce energetic. He has created Happy happens to everybody. Such a wonderful session, especially on gut health, especially gut brain axis have been a core theme of his presentation. Where gut microbes will help in having a better brain functioning and all the diseases. And even he has mentioned the particular microbes, the most unique presence of your individual. This is something which is very take home message from his presentation. I thank him for this vibrant session, and he's from I think he's not present right now, but his presentation is well accepted from all audiences and present over here. And the third is he really deserves and another wonderful session by our own consultant homeopathic specialist homeopathy, Queensland, Australia. She has come. A very beautiful session about mathematical education methodology and well structured methodology to evaluate and give a good assessment of teach. It gives you very specific objectives for the learner teach in mathematical and what has to be assessed from mathematical person and how he is to be competent. And this is what is required the competent based curriculum activities. And she has given 34 wonderful points and it is a very successful and even it is a good privilege to attend your session and we are very happy that you will bring that to the crowds and they may be taking that lessons through them. Another important session, our own Dr. Mangaluru Upadhyay, veterinary doctor, and he is a scientist. He is the veterinary doctor. He is a homeopath. He blends the common understanding of homeopathy into the real practice of veterinary conditions. And this is my second session in his presentation, but he has focused today on intoxications and animals related problems and wonderful explain what is the cause and how they can be intoxicated what is especially on sleep paralysis, Viagra, Naja bite, miraculous cure within 48 hours. It is a wonderful documented evidences and homeopathy helps, especially on veterinary conditions, and it is from scientific spirit. We are looking at very well with the video presentation. Thank you so much for your presentation, and we are really happy to be part of this particular session. And another person, Dr. Dishana, has presented on part of Mitra for Life, their integrated approach in community participation in the neurodevelopmental disorders, especially in children. This was a holistic approach. We have designed this holistic structure, built neuropsychiatric developmental system of children, and I feel it's one of the unique in the state and she has presented 8% of ADHD cases, like 1% is autism and 7% of ADHD. How to deal with homeopathy along with supportive therapies. It is all the beautiful, the structure, and most of our we can search that community level and can progress in such scientific works, collaborating such institution. I think it's a wonderful presentation, Dr. Vishal. You're doing very well and thank you for being here. Yes. The teachers of teacher, Dr. Praveen Kumar, and he was a principal of JSPS as well as he was a HOD of practice of medicine, wonderful knowledge on practice of medicine. Same as even regarding AMR, antimicrobial resistance cases. He has done earlier also, there are so many cases like vitiligo and so many researches he has done when he was doing the post graduation as well as when he was teaching in JSPS. I know many of his articles and one such presentation he has done antimicrobial resistance with the help of tuberculum tenem as well as lycopodium 001 where it can create a sensitivity also. I feel there is a
we can work as an enjoy in most of the clinical condition where even the really cannot be given to a homeopath. So you cannot treat TB brainwash in such condition, persistence cases where we can show the results and definitely one motivation also we have it really for the tuberculosis. So your presentation has given a very scientific ideas and you have presented very sweetly and I thank you for your presentation over here and it was a very insightful study. Thank you, sir, for presenting here, and we are very honored with your presentation. And with this all presentation, one thing is there that we have to work uniquely with the using of homeopathic spirit and homeopathic scientific tools that Hanuman has given. He has given it in long back, but now the scientific way that we have to update ourselves into a documentation, well documented, well structured method, which works so good. Homeopathic is effective globally and it is so locally and homeopathic alone. With this word, I conclude this session. Thank you for being a patient hearing and thank you for the opportunity for Kadamuli Homeopathic Medical College combined with GHF and the CCRH. This October 2025 has made one insights to many people. Go for research, go for the work and clinically through homeopathy and play homeopathy. Thank you very much.
Thank you, sir, for your insights and regarding today's session with such clarity and depth. Your contribution has added immense value to our discussions. May I now call upon our chairperson, Dr. Veerabhadrapa C, to share a few words.
Good afternoon, everyone. It's my privilege and honor. Dr. Pravesh Rupkar sir has invited me as a chairperson. Thank you, sir. Really, it's a fabulous scientific session. So the society now wants to be an evidence-based research study. Okay, it's request all the delegates to have a research publications, especially in case of Scopus, PubMed, or Web of Science, there as an international journals, you research there and show the evidence base, clinically proved evidence base, so that the message will go to the globally, then the society will see how homeopathy will work. Yes, sir, as efficacy and then on veterinary basis, evidence basis. Evidence, people want evidence base before and after. So by this, I conclude. I thank you, the principal, Professor, sir, and the teaching and non-teaching faculty of Father Muller, Medical College. Thank you, one and all.
Thank you, sir. May I now invite Dr. Amita Pipaliga, HOD, Department of Homeopathic Materia Medica, Father Muller Homeopathic Medical College, to present the token of gratitude to our moderator, chairperson, for their valuable contributions to the session. We now move to the most exciting moment, which is the prize distribution ceremony. This is the time when we celebrate hard work. I now invite Organizing Secretary Dr. Sheila Kayens to escort the dignitaries onto the dais to proceed with the prize distribution.
Now I also call upon Dr. Shravan S. Kumar, Department of Organon of Medicine, to brief about on the competitions held.
Good afternoon, everyone. We are delighted to communicate this proud moment at EXPLORA 2025. Today, we recognize and celebrate the exceptional individuals whose contribution have stood out in the highly competitive field of participation in various categories. The first competency was conducted on 14/11/2025. Case report by case series presentation. There were total 44 presentations, out of which 16 papers were in the faculty category, 15 papers were in the PG category, 15 in the youth category. The winner of case presentation in faculty category is Dr. Shruti Kakade, Assistant Professor, Department of Medical College, Delhi. Prize of appreciation goes to Dr. Ramisa Urvendi, Associate Professor, Sri Sairam Medical College, Chennai. The winner of case presentation in PG category is Dr. Fatima Kenneth, Department of Organon of Medicine, Government Medical College, Calcutta. The prize of appreciation goes to Dr. Santosh Kumar A, Department of Laboratory, James Homeopathic Medical College, Hyderabad. This presentation in which is Miss Kate Connelly. Yes. The prize of appreciation goes to Ms. Vigneshwari K, Sri Sai Ram Homeopathic Medical College, Chennai. Now we move on to research paper competition conducted on 15th November 2025. The total number of papers presented were 39. 15 papers were presented in the faculty and practitioners, 7 papers were presented in the postgraduates, and 17 undergraduate students. The winner of research paper presentation in faculty practitioner category is Dr. Jessica Montero, Associate Professor, Department of Medicine, Intl Homeopathic Medical College. The prize of appreciation goes to Dr. Shrey Jagay, Assistant Professor, Department of Pathology and Microbiology, Intl Homeopathic Medical College. The winner of research paper presentation in PG category is Dr. Bhumi Patel, Department of Repertory, Dr. Intl and Mangaluru College. The prize of appreciation goes to Dr. Rahul S., Department of Organ of Medicine, Homeopathic Medical College. The winner of research paper presentation in UG category is Mr. Alias Q. Varghese, Acharas Raman, NSS Homeopathic Medical College, Kottayam. The prize of appreciation goes to Ms. H. Deepika, Sri Sairam Homeopathic Medical College, Chennai. Dr. Shruti Kakkade, Assistant Professor, Department of Homeopathic Medical KAE, in the prize for bag under the category of faculty. The next competition conducted was poster presentation held on 15th November 2025. The winner of poster presentation under the faculty and practitioner category, Dr. Premalika Rosti, Department of Repertory, A.M. Sheikh Homeopathic Medical College, Belgaum. The winner of poster presentation competition in PG category is Dr. V.S. Lakshmi, Department of Pediatrics, Father of Medical College. The winner of poster presentation in UG category is Ms. K. Kadambari, Indian Father of Medical College. We take this moment to honor the person whose creativity gave this conference its name. The title was coined by Dr. Hindu OS, HOD of Department of Office, Medicine and Father of Thank you.
Congratulations to all the winners. I now invite Chairperson of the Organizing Committee, our Principal, Dr. E.S.J. Prabhukiran sir, to conclude EXPLORA 2025.
Dignitaries, on the days and of the days, and dear delegates, it's not a conclusion but exploration further at this year, at after Explora 2025. And thank you for being part of it, faculty, students, and resource persons, moderators, and speakers. Thank you very much for making this Explora 25 a grand success.
I now invite Director, Reverend Father Frosty Lucas Lobo sir, to speak a few words.
Afternoon, friends. They say we cannot preach to the hungry stomach. All are getting ready to go too, so I don't want to prolong your being for the lunch. We have a very good quote. Homeopathy has a better answer. Yeah, we realize that. And we were reinforced with this idea that homeopathy has an answer. We are convinced of homeopathy having the answer. Let us go out and proclaim to the world that homeopathy is the answer for the ailments in the world. Shall we therefore take this as a movement? Let us say that we will not rest until homeopathy is known by everyone in the world. And everyone believes that homeopathy has the answers. I wish every one of you all the best and your parents. Go and promote homeopathy and make the lives of people happy and thank you. God bless you. All the best.
Thank you, Father. Thank you to all our dignitaries for their valuable time, guidance, and extension. Thank you to all our speakers for those insightful presentations and to our audience for your digital participation throughout the session. Thank you all.
Students of Mangaluru Homeopathic Medical College, we will have a session with the dignitaries in Trustees of Homeopathic Foundation. Immediately after lunch, get back to the auditorium at 2:30. Thank you.